have to go do an interview at 12, and so I'll miss lunch, but I hope to be back right around when we start. Trina. Oh yeah. If I'm not back, you'll just start everybody at 1:15. And then I think we're going to run the 1:30 state of practice, cut it off by 15 minutes. So 1:30 to 2:45 still gives you a good amount of time, but we'll just make it just a little bit shorter, and that should be enough. And then we can always make the closing remarks really, we love you and have a good day kind of thing if we have to. All right, so we have an exciting day in my opinion. I'm already eating up time into it, but I'll say quickly, I want to make sure that David, he's come from Italy. If you get a chance to make sure you stop by and say hello, because it's great for him to come. He's at, what is it, Urban? He's at Urban right now doing an appointment there, and his family's here, so excited about having him. They got some interesting findings they're doing around children's savings accounts and college graduation. So I think that's important for us in the field because we haven't had kids yet in graduating in that age, so I think it's really important. We have some findings today from Maine. We have some findings today about seed, which we're really excited about. That and looks really great. So actually, today should be a number of other things going on today. So today should be a really exciting day where you get information that you can take to the field in new studies and stuff. So if you thought the arrow was up with the growth of the programs and everything, I think after today, the new findings and stuff that we're seeing should make you feel like we're even going farther up because we're reaffirming what we found earlier, and that's great to see. So with no further ado, if the panel could come up and we can get this moving, it should be an exciting day.
Good morning, everyone. So I'm going to do my name is Mark Hernandez. I'm going to do an introduction to our panel here, and then we'll, our presenters, and then go down in order. So this morning we have 4 leading scholars representing diverse fields of study, including social work, sociology, social psychology, and public policy, who will be presenting new findings from studies that they've conducted, describe the knowledge base supporting their research, and consider implications of the findings for the field. Each panelist today is going to be, will present for 15 minutes. And after each of those presentations, we'll open the floor for 1 or 2 burning questions if you have questions about their work and clarification. And then after they've all had an opportunity to present, we're going to open the floor for discussion. So hopefully we'll have at least a half-an-hour discussion at the end. And so I'd like to begin by introducing each of our panelists and a couple notes about their presentations today. The first person that will be presenting is Nick Sorensen. Down here at the end. He's a principal researcher at the American Institutes of Research, AAR, where he currently directs the Optimizing Outcomes Lab. His research uses experimental and quasi-experimental methods to develop and test innovative educational interventions and policies focused on increasing educational attainment for disadvantaged students. And when I saw your bio, it was of note that you are coming home to your alma mater.
It's great to be here.
University of Michigan, where you obtained a doctorate in social psychology and master's in social work from here, University of Michigan. I'm not going to say anything about your results. I don't want to steal anyone's thunder, but I will say that, that Nick will be presenting results on 2 cluster randomized control trials using household level random assignment to compare households of students with and without grocery store rewards cards in 2 demographically different communities in the Midwest. Grocery store reward cards pay rewards as a percentage of purchases directly to CSAs and are a new tool designed to overcome savings limitations, and really hot off the presses results from Nick. Next, Zibe Chen will be presenting. She's a postdoctoral research fellow here at ADI. Her research focuses on understanding financial behaviors and decision-making among low-income individuals and interventions that promote financial inclusion and economic security for low to moderate income families. Since joining ADI, she's been working on research projects evaluating children's savings programs in the United States. Zibe will be sharing findings from new research examining how Maine's shift from an opt-in to opt-out policy affects participants in their educational expectations and health outcomes. We heard a bit about that shift yesterday. Zibe will also share some new findings from an ongoing innovative CSA program in Washington County in Indiana that combines CSAs with additional scholarship component. Next, Davide Azzolini will be who is a research fellow at the Research Institute for the Evaluation of Public Policies at the Bruno Kessler Foundation in Italy, will be presenting. He currently serves as a visiting fellow, as you just heard, at the Urban Institute, where he conducts research related to asset building programs, education, and international comparison of social policy programs. In the past years, he's engaged in the design and implementation of large-scale randomized control trials on the topics of higher education participation, student achievement, and teachers' digital competencies. Davide holds a PhD in sociology and social research from the University of Trento and a master's degree in public policy analysis from Corep in Turin. Davide will present the results of an RCT examining the impact of college participation on a matched savings account demonstration program carried out in Italy, the Affording College with the Help of Asset Building program. The tested program targeted low-income high school students and provided a 4-to-1 match rate to cover college costs. And then, last but not least, Trina Shanks will present. She's an associate professor and director of community engagement at the University of Michigan School of Social Work. Her research interests include the impact of poverty and wealth on child well-being, asset building policy, and practice across the life cycle in community and economic development. Trina has been active in the city of Detroit, including conducting multiple evaluations of its summer youth employment program, Grow Detroit's Young Talent. She earned a PhD in social work from Washington University and a master's in comparative social research from the University of Oxford's Rhodes Scholar. Trina will be presenting results from analyses of new follow-up data from preschool participants at the quasi-experimental Michigan Seed site who are now completing high school. She will share findings around graduation rates from the class of 2018, standardized test scores in reading and math in 3rd and 6th grade, and SAT scores in 11th grade. A lot of brand new results. So without further ado, I will be quiet and turn it over to Nick.
All right. Good morning. Can everyone hear me okay? Excellent. All right. So as I mentioned, we're going to be talking about the results of 2 randomized trials that looked at the impact of rewards card programs on saving and asset accumulation. And so I'm just going to kind of jump right into this. Some of this background is pretty obvious to you guys. You know that CSA programs are on the rise. We also know some of the benefits that are associated with them, socio-emotional well-being, educational expectations, reduced maternal depression, enrollment and performance in college, all these sorts of things. At the core, though, CSAs are also obviously a financial instrument that's designed to sort of build assets to help students have a financial pathway to college. And that can be tricky. And we know that families are saving using these vehicles, but they're saving at lower rates than we would like. And so the question is, what are other different ways that we might improve savings within the CSAs? So the central problem, you might say, is that low-income families just don't have enough money to save, right? This is pretty straightforward. We hear that from surveys. 65% of low-income families report that inadequate income is a barrier. Basically, after you pay for your basic needs, there's nothing left over. But interestingly, this is also true for middle-income families. They say the same things: it's difficult to save for college. So is it possible, then, to use a rewards card to transform spending into saving? We all use rewards cards all the time. Would this be a potential mechanism that would help families be able to put some money away in their CSA? What's great about rewards cards in this case is that they would provide families with a CSA the opportunity to save each time they make a purchase at a participating vendor, and that would include when they're paying with SNAP benefits. We also, and then in return, the vendors actually, sorry, I'm like got something in my throat. In return, the vendors can expect an increased volume of traffic through their businesses by getting people to sort of take advantage of these rewards cards. There's also no additional cost to the user of the rewards card, right? It doesn't cost money to have this card. It doesn't mean that if they use this, they can't get the discounts that the store offers and so forth. So we conducted 2 randomized controlled trials, and they're in very different sites. So the first one, study 1, is in Indiana, Wabash County in particular. And it's a partnership with Kroger that provides up to 5% in rewards based on your spending at their stores. As we know, this area is largely rural, nearly entirely white. Most residents have completed a high school degree, and about 1 in 5 have a bachelor's degree or higher. So it's relatively more advantaged relative to some contexts we might think about. Only 13% live below the federal poverty line, though that differs for, it's higher for individuals who haven't completed high school and lower for those who have a bachelor's degree. Study 2 is similarly a partnership with Schnucks Grocery Store that provides up to 3% rewards in the College Kids program. This is in St. Louis, right? A very different context. It's an urban area. Racially, it's half black, half white. Only 1 in 3 residents have a bachelor's degree, and degree completion rates, of course, differ quite a bit by race and ethnicity. Poverty is quite a bit higher in St. Louis than in Wabash County. More than 1 in 4 families live below the poverty line. And black families are nearly 4 times more likely to be living below the poverty line in St. Louis. So this provides 2 very different contexts to ask, does giving access to rewards cards provide a valuable vehicle for saving? So we had one set of central research questions. What is the impact of providing grocery store rewards cards to households of students with CSAs on the following outcomes? So the idea is you already have a CSA. We're going to randomly assign you to your family to either get a rewards card or not. And then what is the impact on the following outcomes? So first, whether or not households are engaged in saving. And this includes by contributing to their CSA through typical mechanisms like making an individual contribution or through the rewards card, which is something you would only do if you have access to the rewards card. We also were interested in household contributions. So does somehow providing the rewards card actually make you more likely to make a contribution? Maybe you increase the number of your contributions, the value of your contributions as a result of engagement with the rewards card. And then, of course, also total dollars saved. Does providing this as a vehicle for saving actually increase the dollars in the account? Okay, so study 1, just some brief information about this. It's a cluster randomized trial with 1,390 households randomly assigned to either get the card or to a delayed treatment condition where they will receive it later, 9 months later in this case. And then households were randomly assigned within blocks. So why do we do that? We want to make sure we get 2 equivalent groups. We were accounting for their existing saver status. Have they ever made a contribution previous to this point? Their free and reduced price lunch status. Is possible that if you're more economically advantaged or disadvantaged, you're going to be more likely to use the rewards card or not. So we wanted to account for that. And then, of course, also the number of children with CSAs within the household, right? So you might be less likely to make contributions to individual CSAs the more children you have, the more you're stretched financially, that sort of thing. We want to account for those sorts of things. Some participant characteristics of the first study. About half of the households had previously made 1 contribution, so this is rather high. About half of the households also had at least 1 child who qualified for free or reduced price lunch within this particular sample. And then if you look at, there's a total of about 1,800 CSAs that were nested within about 1,400 households. You can kind of see how that breaks down with how many kids in a family, basically. All right, so we're just going to jump right into some of the results here. So this is the first question, asking, does providing the rewards card increase the percentage of families that are engaged in saving? Now, this could be either through using your rewards card or by making a contribution. The question is, are you engaging with your account? So you can see here that both at 3 months out and at 9 months out, there's a 20% bump among the families or households that were in the treatment condition and had access to the rewards card. It's pretty stable. So you can see like the overall numbers are increasing over time. That's because over time more families are making contributions, and that's true in both the treatment and the control group, but you see this consistent 20 percentage point difference. So you might ask, okay, well, does this differ for families that are more economically disadvantaged? So we looked at how this broke down for students receiving free reduced price lunch or not receiving free reduced price lunch, and interestingly, it's incredibly consistent. So there's no differences here. You see the same kind of impact for both of these groups. And this is at 9 months, by the way. Okay, so you might say, all right, so there's an increase in the percentage of families engaging with their accounts, but maybe they're just making more contributions. Maybe it's not about the rewards card. That's not the case here. So we can see there's no significant impacts on individual contributions at 3 or 9 months. So that includes whether or not the households ever made a contribution during that time, the number of contributions to the CSAs, the total dollars contributed, and all of these things did not differ by free reduced price lunch status. So that means that it is use of the rewards card that's actually bringing new families to the table to engage with their CSAs, if you want to think about it that way. So you might say, okay, all right, well, for those who did use it, and for the researchers in the room, this is sort of treatment on the treated. For those who did use the rewards card, what were the benefits? So in this case, in the treatment group, so those who are provided access to the rewards card, about 1 in 3 CSAs had rewards attached to the account as a result of usage. So there seems to be about a third of the families getting this, and their associated CSAs are actually taking advantage of it. And then if you look at within those families that use it, what are the kind of rewards they're getting back after 9 months? So as I mentioned, this can range from 1 to 5%. I will let Willie expand more on sort of what determines the 1 to 5%. It has to do with sort of community-wide usage of the rewards cards and things like that. But basically, you can see here that as you go through this, the mean is somewhat small. So you go from $6 here, but all the way up to $32 at a 5% reward. But you can see that that's the mean across this whole group. And then there are a number of individuals that are actually taking advantage of this and getting upwards of $200+ at the end of 9 months in their account by use of the rewards card. It's pretty significant. So you might ask, okay, well, does the increased dollars in the CSAs as a result of using the rewards card, does that translate to a population effect? Because this actually is a population study. We took all the CSAs and randomly assigned them. And interesting enough, at the end of 9 months, if you look at the 5% reward, it does. It averages across the population as $15.50 in addition, on average, in accounts at the population level. Now, of course, we understand that's all concentrated to about 1/3 of the families there, right? And so the question would be how you would expand that out and get more families involved or to use it more frequently. All right, so I'm going to move on to study 2. Also a cluster randomized trial, a little bit bigger in size, so about 8,350 households randomly assigned to get the rewards card now or to delayed treatment. It's kind of similar design. We also blocked on similar types of things, whether they had made a prior contribution. We didn't have information on free or reduced price lunch for this sample, so we also blocked on prior assets, so total assets within the CSA prior to random assignment, and we also, again, number of children. So here you'll see that the percentage of households that are saving is much lower, right, than in Wabash. So it's 3% in contrast to 47%. And we also see that we have about 9,500 CSAs in total nested within about 8,300 households. Okay, so asking a similar question. Are we bringing new families to the table? Are they engaging with their accounts? So you see this kind of low base rate of saving as we've seen before. And now by using the rewards card, and now instead of 2% engaging with their accounts during this 3-month window of time, and I should say these results are only 3 months out, not 9 months out, we have nearly a 6-fold increase, or nearly 7-fold increase actually, in the percentage of families that are engaging with the accounts as a product of the rewards card. One thing that differs in St. Louis here is that they have a number of opportunities to participate in incentivized activities, and that's a way that they can also get money within their account. There's some elements of that's actually true in Promise, Indiana too, but it's a little bit different so administratively. But one thing you might ask is like, okay, so there's an opportunity to save by making a contribution, there's an opportunity to use the rewards card, there's also an opportunity to participate in these activities. What happens in that case? And if you include those other activities as well, you can see that the base rate goes up. So 19% are engaging with their accounts in some capacity if you include those incentivized activities. That goes up to 26% still, though, even with the rewards cards. So a noticeable increase in families engaging. Similar kinds of findings here. No significant impacts in individual contributions. So as the differences in those bars that we're seeing are a result of using the rewards card. That's really, I think, the important point here. As I mentioned before, in Wabash County, about 1 in 3 were using the rewards card. In St. Louis, it's 1 in 10. I should note that there did happen to be a fairly sizable portion of the sample that actually didn't get the rewards card. So that might explain why sort of these usage numbers are a little bit lower. That's something we would want to figure out how to address going forward. For those that did use the rewards card, they had an average of $3.61 in rewards after 3 months. And those rewards haven't yet accumulated to produce a significant population impact. That's, of course, something that we would grow over time. So some conclusions and next steps. This does make clear that rewards cards can provide a valuable vehicle for turning spending into saving, and to engage households that otherwise would not have made a contribution or that otherwise would not have engaged in participating activity or incentivized activities. We also are observing significant increases in asset accumulation over time in Wabash County, and we need to continue looking at that data in St. Louis and stay tuned for those results. We also need to be examining non-financial outcomes. So I started off saying this is fundamentally a financial vehicle. We want to understand what that is, or what the value is here of these rewards cards for financial outcomes. But it's also possible that swiping that rewards card every week reminds you about why education is important to you. That changes the way you communicate with your children, which changes the way they engage with school. All of those are future avenues for research. And lastly, we need to better understand how to increase and maintain usage of the rewards cards, right? So there's not a lot of opportunity to expand usage here and to have people maximize their benefit. So what I didn't tell you is that we did look at one thing. There was an additional aspect of the study that we did in Indiana, where we asked, well, would messaging about the short or longer term benefits of the rewards cards increase usage? So we have this very interesting design. I'll spare you all the details about it. It's called a sequential random assignment, a sequential multi-assignment randomized trial. But basically, over here in March 2018, you can see we randomized people to treatment or to the delayed treatment. That's what I told you about. But then, among those who get access to the rewards card, after 3 months, we see which ones are users and which ones are not users, right? So 32% were users, 68% were not. So then, among each of those groups, we randomly assign them to either get no messaging, a short-term message about the benefits, or a long-term, or a message about the long-term benefits, right? And we can look at, does that increase the usage of the rewards card between July and December? This is just an example of the email about what short-term looks like, $439 per year, long-term, $1,908, and you're $529 by the time your kid goes to college, right? And here's the results. So what I can tell you is that these messages did not increase usage for the previous non-users, though you do see 8% of previous non-users becoming users. What you can see, though, is among users, there is a significant bump for either of these messages relative to no message, right? There's no difference between the short and long-term message, but getting some messaging about the benefits and reminding you of it actually does keep you involved and keep you making contributions. So more of this work is needed. It's easy to do. We all can do it, learn a lot, and figure out how to maximize outcomes. That's all.
Thank you, Nick. So I said we would open up the floor for one or two burning questions for Nick, but I want to start, since I'm the moderator, with one. And I have a question about, do you have any qualitative data around from parents about, or household members about the use or non-use, facilitating use or non-use of the rewards cards?
So I don't. Willie, I'm not sure if you have access to that.
One clarification, the 5% became more aspirational because originally we had hoped that we'd get Kroger to go to 5%, and they did not. And so at least it gives us an idea of we really need to hit that 5% mark to have kind of a larger asset build. But no, we don't have any yet. We intend to do some. As soon as someone out here gives us some more money, we'll go out and do that. Thank you.
All right, anyone have a question? Therese. We'll bring the microphone to you so we can hear you.
Thank you. I just had a clarifying question. When you use the reward card, does it go directly into your savings account, or do you have to take an action to make that happen? I just didn't understand the process.
It goes directly, yeah. It's not like immediate that moment, but it's like by the quarter, basically. It gets applied.
Okay, thank you.
Amanda or Clint?
In Wabash, what happens is the Wabash County Promise is where the funds come to, and so once we have that, we have the account numbers for each of those families. And so we do the allocation, we send a check and roster, and then it goes into their accounts via that way. It does not happen directly through Kroger.
What? It's the same for St. Louis as well. We get the check, we have a roster, and then we make the allocations into their account as well.
Amanda, did you have?
Each quarter, so they like have that evidence of the impact of their shopping and their rewards. Like, can they tell? Can they? Oh, I'm sorry. I was asking if families physically see on their statement this amount, and that would be presumably a further incentive to use the card.
Yes, so in their account, when that deposit is made, it is coded as a Schnucks deposit, so they see that it is coming from the grocery store. Because this is a relatively new implementation for us, we did have some delays, so it didn't happen right at the quarter change. We had some stuff we had to work out, but yes, they do see that that Schnucks deposit is there.
The other thing that needs to be developed and refined is the messaging. At the bottom of every receipt that they receive, you have the ability to put whatever message is in there, so when they shop, it says your contribution is going to support whatever. And so we didn't really focus on that in this study, but you can tailor that message through Kroger to use as an immediate reminder that their shopping is going to their future education.
Well, one more question right up here up front. Same question? Okay, good. We got to cover. Anyone else? One more. We can take one more. Oh.
I just wondered if there were any thought to, or you had any focus groups of the Kroger's folks in terms of messaging to help families make better decisions that could accrue more savings to the model. Like, for example, if Kroger's had a special on steak, and if you bought steak next time, like CVS does, you could actually buy something that's healthy, and steak isn't really healthy, and get a discount that could then actually accrue. So I was looking at the text messaging and thinking, what an opportunity for business to kind of source what kind of joint messaging might be helpful for future earnings.
I take the blame for a lot of this because of randomized control trial and the newness of the program. We kept it very bare bones. I mean, I know Clint had some great ideas on how to, so this is really like, even with the text messaging, we didn't do any messaging before that. We just sent them the card, right? And so this is like the minimalist approach to it. And as they move into new phases, they're going to do more stuff. But I just wanted to keep it so we could control for everything. We didn't take advantage of the fact that the families can distribute the cards to other families and do all that. We just try to keep it really simple, so I take the blame for that. But that's a good idea. Yeah.
Right.
Yeah, no, I think we can, and in some stores it's more doable than others. So these are things we have to work out. We hope is it triggers people's interest, and we can get a little more money and do some of the focus groups. Even with the messaging, we did it ourselves, and we're not experts at creating messages. We need to have marketing groups come in and really think about how to do some of that.
All right. Nick, thank you.
Hello, everyone. I'm Bei. I'm a postdoc at ADI, working with Willie. This past 2 days been very inspiring for me because I'm new face as this is my second time being a CSA conference. And honestly, the first day was devastating to me because I heard all these people talking about the history of the CSA policy, and the message, I guess, data doesn't matter as much in terms of making policy. And I just freshly graduated from the PhD program, studying data for 7 years. But today I'm, being encouraged again with the new RCT and see the enormous interest in this house that in the new studies, what data can say about the new designs. So I will be presenting some findings that we did in the past few months about the promised scholars in Wabash County, Indiana, and the very first statewide CSA program in Maine. So the first study is on the promised scholars. This is a program in Wabash County, Indiana, looking at how can we help people save more money and encourage people to engage in the program. So this is, the program has the two components. So one is the CSA, the common components that built on the state's 5 to 9 college savings plan have financial incentives. And the other innovative component for this program is we add the scholarship that targets the 4th to 8th graders, and students will get awards and for completing some benchmark school activities. So I'm sure the program staff here will better answer this question about the details how these incentives were delivered in the field. I will go straight to the study and show you the main findings. So we did a study to looking at the different groups and looking at how adding a scholarship component can affect the students' the academic performance. So we collect data from the 3 Wabash County school districts, have a total about a little below 2,000 students in our study. And the outcome we're looking at is mainly the math and reading scores. And we compare different groups who don't have a CSA and groups who only have CSA, doesn't have a scholarship, and the group who have the promised scholars. From this group, we have people who actually save in the program who did not. So people who save, we call them promised scholar savers. And we were thinking that having this group here to demonstrate, to trying to find out whether people who, students who are actively saving are any different on their performance and their academic performance. So the data analysis approach we did was a propensity score matching and the matching estimator. So we basically matching students across all the 5 groups to make sure they are comparable on 5, 6 variables. That's gender, grade, free reduced lunch status, and special education status. I don't have the numbers here. Oh, okay. Further down. I don't have the number on the slides, but so 41% of the sample, that's 797 students in the sample are promised scholars, and within 14% of the students are promised scholar savers, meaning they are actually saving in the scholarship. So we have some correlational findings. This is not, all these findings here doesn't apply. We find the causal relationship between the program and the outcome, just because the research design we're using is not RCT. So the first main findings we have here is the children in the promised scholars have significantly higher math and reading scholar scores than the children who did not participate in the promised scholars. And also compared to the children who have the CSA only, the children who has CSA and the Promise Scholars have a higher math and reading scores. And the association is stronger for the low-income sample than the full sample. So we look at the two samples. We have the full sample about 2,000 students, and we have about the part of the sample we identified as have the reduced or free lunch. So those are the people who we consider that living in poverty and are our low-income sample. And the children in the Promise Scholars with contributed savings, namely PS savers, have a higher math scores and reading scores than those who has no CSA and the PS Promise Scholars. And the association is also stronger for the low-income samples. So when we compare the Promise Scholar savers versus non-savers, we find that the savers have a higher math scores than the people who did not save in the Promise Scholars. And that this association is true, holds for the math scores, but we didn't find the same thing for the reading scores. So the main takeaway is that so when we combine the CSA and scholarship, we see a strong relationship with academic performance. And families who contribute saving in the Promise Scholars their kids have a better academic performance. We're thinking maybe the saving contribution signals active engagement in this case. And compared to the average child, children from low-income families appear to benefit most from the CSA, the scholarship, and the CSA and scholarship combined. And I can't emphasize this enough that all these findings present here are correlational and not causal. So we cannot rule out the possibility of a selection bias. So the next study is on the Harold Alphon College Challenge. This is the oldest CSA statewide program in the country. And we did 2 studies on this program looking at the policy shift, how the policy shift on the universal enrollment could affect the students' outcomes. So all these, I can skip those program components. I'm pretty sure everyone familiar with those. And the time mark here is 2014. The HACC's shift from opt-in to opt-out. So we collect data in 2018 from families with children born between 2008 and 2017. We identified 3 groups. So we'll have one opt-in group these are the group of children who enrolled in the HACC during the application time period, that's before the 2014. And we also have the comparison group, which include children who did not enroll in the HACC before 2014, that's the application-based enrollment. And we identified the 3rd group as opt-out group, has children who enrolled HACC as a result of automatic enrollment. So we did a multivariate regression analysis and looking at the parental educational expectations. So the main findings here is that when we compare parents who has children enrolled in the program before 2014 and the parents who have children who opt out, which is the 3rd group that has children in the group after the 2014. So we look at these parents and we found that HACC parents are more likely to expect their children to attend college, and they have a higher level of confidence in their children completing a college degree. And when we look at opt-in and opt-out parents, there's no difference found on the educational expectations, which to me was surprising. I thought there should be a difference between the opt-in and opt-out parents, thinking that opt-in parents probably have a more strong awareness of their children enrolled in the program because they have to take effort to do so. But here we didn't find a difference. And we also find the parents' perceived academic performance of their children matters for whether they expect their child to attend college. So academic performance throughout all these comparisons shows significant difference in terms of determining whether the parents expect their children to go to college. Again, these are the correlational studies, no causal, and we can now rule out the possibility of selection bias. So the second study is we're looking at the health outcome. I know there's already some studies on the COK looking at the parents' health outcome, but here we're looking at how parents rate their child's health outcome. Health outcome in this study is the subjective parent-rated children's health measure. We have this one question asked the parents to rate their children's overall outcome, whether it's poor all the way to excellent. So we again looking at the groups of opt-in and opt-out combined and the comparison. And we found that HACC parents are more likely to report that their children have a better health than the parents who are having children who are not in the HACC program. And there's no difference were observed between the opt-in and opt-out again on the children's health. So earlier we talked about the qualitative piece on the rewards cards. We want to see more qualitative to really understand the nuances in the program, how the program works for the families. So we did a qualitative study here on the main program to understand how programming of features affects the parents' saving experience. And we want to understand how parents have their children enrolled in this program perceive the impact of the program. So we have these three research questions. And I see my time's up. I'll go this rather quickly. So parents were, so before the universal enrollment begins, parents have to take action, enroll in the program. And some of the, recruitment, it happens in the hospital. And we found parents in our sample find that birth is a difficult time to enroll. And there's parents says, especially in the hospital, it's giving a lot of information and taking it all in, especially for new parents. You have all this stuff and you're overwhelmed, and having children, and then you get home, your paper just get piled up. And the other thing about the program perceived impact from the parents is that we found a lot of parents report that HACC influenced the conversation around money at home and setting educational expectations at home. So there's one parent mentioned we have a lot of conversations about what things in the future they would be saving their money for, and college is definitely one of them. And we do talk with children about saving money in the context of the regular saving accounts. They understand, and then they have a college account. And the other theme we found in our data is that parents report this program ignited their saving efforts, encourages to budget and restrict spending in order to save. So one of the parents mentioned it gives you, HACC gave you a good start because it puts money in there and you don't have to take out your pocket. Because the money was put in there to start with, that really gave me the boost and the incentive to be able to add to it. And we also found that the program, being in part of the program, actually help parents start thinking innovatively how to save in the account. So there's a parents mentioned, I think it also gets family members involved in the way that they wouldn't have otherwise. Maybe until that kid is graduating high school, we've already had people contributing just at birthday parties and things like that, because that they know that we are part of that program. So I feel like it just kind of brings that all together for everyone, involving everyone. I have a really big family, and so I think the ability to sort of already contribute and feel like they are contributing, I'm trying to move past birthdays that all presents. I think the parents thinking, there's one parent, this is the parents talking about, instead asking for birthday gifts, they ask the family members to contribute in the HACC account. Okay, and the last main findings we have is, as we've also found in the quantitative studies, that low-income parents and parents with additional financial responsibilities find very hard to save. And we identified parents who are single, who are older parents that are trying to save money when they start having kids late, and they are, they feel hopeless when they're trying to pay other loans and also have to save for their kids. It's very hard for them to do. And parents with student loans and young children. Okay. I will talk about the takeaways at the end if we have time, but that's all I have, and thank you. I'm way out of time.
Thank you, Zibe. So let's open the floor to a couple of questions. Anyone have questions for Zibe?
Yes, in the back.
Hi, thanks for that presentation. That was fascinating. I did have a question just to clarify for the health measures. How much do you think there's a sense of improved self-efficacy in terms of is it a subjective reported measure on health? Yeah, could you speak a little to that?
Yes, this is, as I mentioned in the slide, this is the subject measure asking parents how they think their children's health overall is. And we did control there's one variable in the model asking whether the children is diagnosed with asthma and a couple of health conditions. So we did have that control in the model. So overall, it is a subject measure, but we think that having that control of diagnosis kind of strengthens the bias made from here. And of course, if in the future we want to measure health in a more objective way, we'll need to use a more objective measure for sure. Yes.
Thank you. You mentioned that participants are actually number one in the takeaways.
Yes.
How strong was that positive outcome?
How strong is a positive outcome?
Yeah, in other words, was it a dramatically increased expectation or I'm sure your detailed research went into that quantitatively, but just how would you characterize that?
I think that speaks to when I look at how strong the association here is, I'm looking at the statistical significance. So in the data, we have a pretty large sample, and I think the statistical significance is pretty strong. But again, this is a correlational study. We could not say, there's from A and B. Right, yeah, I do have all the ratios in the regression. I can show you, how many times that the HACC parents are more likely to expect their kids go to college in the table. Other slides, but I don't have time. Do I have those? I think Okay, here it's the odds ratio here is 1.828, so meaning it's almost 2 times higher of the HACC parents expect their children to go to college than the non-HACC parents.
Okay, thank you very much, Sibe.
All right, thank you.
So first of all, thank you for having me. It's a great pleasure to be here and present you the results from Italy, from this RCT that we run. I hope you'll find it interesting, and I'd be happy to exchange with you all after this presentation. If you're interested to know more, please interrupt me whenever you don't understand anything because of my bad English. Let's start. So what I'm trying to do with this presentation is essentially arguing that match saving accounts could have a potential to increase the effectiveness of financial aid. And that applies also to Italy and not only to the US. I'll try to do that by presenting to you the result of AHAB, which stands for Affording College with the Help of Asset Building, and which is a randomized control trial that we ran in Italy and that was funded by the European Union between 2014 and 17. The program that we tested is called Percorsi, and it was a program targeted to low-income high school students, and whose savings were matched at a 4-to-1 rate for education-related expenditures. To anticipate findings, we do see that the program had positive impacts on both college enrollment and persistence. We don't have graduation already, but we will try to get data in the future to have also completion. We also find heterogeneous effects, meaning that children from lower educated parents and children attending vocational schools, I will tell you more about the education system in Italy. These are the children that benefit more from the program. So what I learned from you is that, asset building programs might have an advantage over standard financial aid programs in terms of improving college success of low-income families, children, because they don't only address financial preparation channel, but they also increase college-bound identity. This could also increase academic preparation, which will be a further channel to increase college success through asset building. So we in this program, we are not able, in this study, we are not able to disentangle the different channels. So we are going to have, unfortunately, only an overall estimate of the program on college success. What we know so far on CSA, you know it better than me, is that there is mounting evidence, experimental and quasi-experimental evidence on the impact of these programs on important outcomes such as child's social emotional development, parental education expectation, and savings behaviors of families. What we don't know yet, as far as I know, is whether these programs have an impact on actual college and post-secondary access and attainment. And this is what we try to do with this paper. What we also know, and you know it better than me, is that these programs might have several issues of regressivity that we need to keep in mind, and we can keep it in mind by either targeting, and this is what we do in our study, either targeting the program to the most in need students and most in need families, or provide additional supports on the top of the matching rate. That reward card, for example, are one of these possibilities. Since Italy for you is possibly an unknown country in regard of these programs and how education works, let me just spend a few words on how Italy works. in what matters for the study. And I hope that it will allow you to better understand the results of our work. So at the age of 14, students are tracked into 3 different high school tracks that are academic, technical, and vocational schools. Those going to vocational schools are typically students from low social background family and with poor performance before. And they also have lower chances to go to the university. So university is accessible to everyone, provided that you have a high school certificate. But if you come from a vocational school, you are very much less likely to go to university. So it's a very, that choice is a very consequential one for students' career in education and future life outcomes. Moving on to tertiary education, keep in mind Italy has a university system which is basically public. It has programs that last between 3 and 3+2 years, so bachelor plus graduate programs. And in comparison to the US, costs of university are very low. The best estimate that I know is about 3,000 euros a year to pay for all university-related costs, excluding rent and excluding, of course, foregone income. Though financial aid, which comes in a form of means-tested grants, basically in Italy, is severely underfunded and very uncertain. From one year to the other, you might find out that you're no longer, that based on your family income, you are no longer eligible. Well, you are eligible, but there are no funds for you to get access to the scholarship. So it's very uncertain and there is a poor coverage. We don't have student loans. It might be a good news or a bad news. I don't know, you decide, but we don't have them basically. And we are performing very bad in terms of university dropout rates. Although I know that US is not performing excellently on this as well. And occupational returns to higher education are heterogeneous at best, right? So I'm providing you with some pills of what is going on in Italy. So, and given what I said, it's not surprising maybe to see that Italy stands out negatively in terms of tertiary education graduates in the population. So we are, in Europe, we are the second last country in terms of percentage of people with a tertiary degree. And US is on the other end, right? So, and connected to this, Italy stands out also in terms of the magnitude of social inequality in higher education completion. So the gap, so you see that there is a more than 50 percentage points gap in the share of graduates among people, among individuals who have high educated parents versus low educated parents. So a country with low educational level, higher educational levels and high social inequality. And just to make the comparison between Italy and US, again, a little bit stronger, we are a country with low tuition fees and very low coverage of student aid, very low share of students covered by student aid, while the US is on the other end. So high tuition fees, but still a higher coverage. This coverage includes loans, so again, it is debatable whether it is good or not. So the program, Percorsi mean pathways. It was a program implemented by a private foundation in Torino, northwestern Italy, since 2010. On this program that was already running, we built a randomized control trial, and within the randomized control trial application, eligible students were students who were enrolled in the last 2 years of high school, so 12 and 13 grades, and that came from low-income families. The threshold was set as at 25,000 euros, which is about 150% of the poverty level for an household of 4 persons. So it's not very low, but then empirically we observed that the median income is 11 euros. So the median income of those that participated in the program was quite low and well below the poverty level. So this is basically how the program works. So it was an opt-in program. People and families were reached out through massive campaign on social media and schools. Families then could sign up, and they had to save between 5 and 50 euros a month. There was no initial seed provided by the program. And I said they had to save because the program had a condition which was the following. Families, all right, okay, families could save, families could skip only 1 month of savings, and they could not skip 2 months in a row. Otherwise, they would drop out from the program. The program provided 2 multipliers, a 4-to-1 multiplier for university-related expenses, and a lower multiplier for expenses incurred during high school, so a 2-to-1 multiplier. At the end of the day, students could get, if they exploited the mechanism to the maximum extent, they could get $8,000, which could well enough cover all education expenses at university in the first 3 years. We recruited more than 1,000 applicants, and we included in the study, since we had a low number of slots available, we included in the study only a fraction of them. But since the program was oversubscribed, we could do a further targeting of the applicants. So I don't have time, given the time that we have, to explain it now. Well, we came up with a targeting strategy based on a predictive model of university enrollment probability, and we excluded those students that had the highest probability of enrolling at the university. The assumption was that the program would work only on those that are marginal students that would not go to the university without our incentive. I skip some details and I go, so it was a blocked randomized controlled trial. I just try to focus on the results. So we find that first year enrollment had a 9 percentage points impact. So the program had a 9 percentage point impacts, and that the program and the effects were persisting also in the second and in the third year. So we don't have graduation rates, but we have a good proxy of it. The program, as I anticipated, worked more for students coming from vocational schools that have lower propensity and lower chances to access university. And the program also worked only for for children from low educated parents. So it worked, essentially it worked only for first generation university students. And this could partly be explained by thinking about this college-bound identity that can be raised by this program, and which is particularly low among families with low education levels. We also tried to assess the cost effectiveness of these programs. So we asked not only what is the impact on college participation, but what is the cost. So how many students does the program need to fund in order to induce 1 additional student to go to the university? And we tried also to compute a cost in terms of euros. And this is the result. So I'm skipping many details, and I know, but I try to convey you the main message. So the program had a stronger impact on vocational school students, and it was also more cost effectiveness on those students, on those subpopulation. To induce one student more from a vocational school to go to the university, the program had to fund 2 students for nothing, let's say, while if we look at academic school track students, this cost effectiveness indicators is much higher. So it is much better in terms of efficiency as well of the program to invest in vocational school students. It's less costly. We have a larger impact and it costs less. And it costs less for 2 reasons. First, because the average of the control students, so the natural transition rate to the university of vocational school students is lower. And second, because vocational school students typically come from lower income families, so they save less and they cost less to the program. I'm skipping here some details because I don't have time. I just want to say a few words concerning the possible regressivity in the program. So we don't observe a heterogeneous effect of the program across income levels. So the poorer households in our sample show the same effects. So we find the same effects among poorer and richer families in our sample. Though we see that low-income family students drop out earlier from the program. Right, I'm almost done. So they drop out earlier either because they cannot save, but the main reason is that they drop out from school. If you drop out from school or you give up your education plans in university, you are out of the program. Connected to this, low-income families also save less than relatively richer families in the sample. They save, on average, 30 euros a month versus 38 euros a month, which is, I guess, in comparison to many other CSA programs here, still a large amount of monthly savings. As a consequence of this differential saving across families, low-income family students also gain less from the program. So the likelihood of getting the most amount of resources possible from the program is much higher for students coming from richer families versus lower income families. So well, I'm just trying to conclude by saying, by identifying 4 possible future research steps that we are thinking about, and I would like to know what you think about that. So we would like to get data on college completion. We need administrative data for those outcomes. We don't know about the channel. So we knew that the program worked. We don't know whether it was all money, whether it was there was an expectation, educational expectation channel playing a role, because we don't have empirical data on that. So, but we have qualitative interviews, and according to these qualitative interviews, families and students felt a sort of encouragement by the program, and they felt more, they felt their self-efficacy increased thanks to the fact of being involved in such program and that there was someone caring about them. We are sure in order to building and to try to contribute to the policy debate in Italy and elsewhere that replication studies are needed. Our was only done in a part of the country, and it was a relatively small one. We are running a new one located in 4 other regions right now. We are recruiting people in these very days. Concerning regressivity, I showed you the data. We are thinking about possible remedials in order to make sure that lower income families can save as much as the others and benefit as much as the others from the program. Thank you.
So I'm going to ask a question of you, and then we'll open the floor to folks. So I was very interested in the survival analysis results that you showed, with the lower income families dropping out over time than the higher income families. And so a question for you is, if you had, you noted that this program is for 12th and 13th graders, so the last 2 years. What are your thoughts about, or is there any thinking in the foundation about moving that earlier, even within high school, a few years earlier, and if that would help with that, or in combination with a reduction in the required amount of what needs to be saved because you have a longer period of time to save for, to help with that problem?
Yeah, I think that so the new study that we are drafting right now targets younger students, because qualitative evidence and some not very robust quantitative evidence show that students enrolled in the second to last year benefited more from the program versus those enrolled in the last year. So we are confident that it should work more for if the period for savings is longer. Yeah.
All right, we'll open the floor to folks. Colleen.
Oh, thank you. So the question I have on the dropout side is, I'm looking at that. It looks like, between the time a student starts and then at the end of the first 12 months, there's sort of what I would think of, at least from the U.S. perspective, for low-income students, a fairly typical dropout rate. It kind of staggers along. Things come up. It wasn't the right fit. Something happens at home, whatever it might be. But then it looks like there's a pretty big drop-off at around 24 months at the end of the second year, and I just didn't know if there was a theory.
No, that's no theory. Good catch, but it's simply because of the study design. We have 2 cohorts, and after 12 months, one cohort is out because some students have finished high school and have not enrolled in a university, so they are out. Mm-hmm. They are out of that's how the program works, and the 24 months drop is essentially the same reason, but for the younger cohorts. So yeah.
Okay. All right. Good. Thank you.
Frank.
Yeah, I might have misunderstood or missed something, but it sounds like the lower income students were able to save less. But in the end, I thought you said it was more cost effective because you only had to support 2 students to get one. I guess, was that to get one to finish? But if they save less, doesn't that mean that given that they would be less likely to be able to continue in school because they can't afford it?
Yeah, you understood perfectly. So it's like that. So they save less, but even if they save less, we don't see evidence on differential impacts on college completion. So when we think about vocational students, not income levels, then you see for them that they save less, so they cost less to the program. Despite this, they have a larger impact. So that we don't have a silver bullet explanation for this. I don't know, but my tentative explanation will be that there is something else beyond the financial constraint reduction going on, and it should be something related to an increased self-efficacy for those students, increased college-bound identity. At least that is what I could say based on the literature and the theory and based on the qualitative evidence.
Thank you.
Any more questions? Okay. Davide, thank you.
As Isma said, I'm Trina Shanks. I'm here to talk about very preliminary outcome data from the Michigan Seed Study. And just to give you an overview when we talk about it, I'm going to give a little bit of background on the MySeed sample. I'm going to talk about how we got the match administrative data, and then give findings on graduation rates and standardized test scores, and a little bit about implications and conclusions. And I get a chance to give a disclaimer now. This is data from the Michigan State Department of Education, but I do not represent the State Department of Education. Any mistakes are myself and my research team, and it's not representing the state of Michigan. And I also would like to say really quickly, there are graduate students who've been working with me on MySeat data for a couple of years now. First, Hannah Rakowski, who's been helping with this data, and she's a law student and been very helpful and on a very tight time constraint when she's doing her comprehensive final exams, helped me get this data ready for the presentation, so thank you, Hannah. And then Ann Blumenthal, who really worked with me over a 2-year period with qualitative survey data, even though we're not presenting on that data now, but if you ask any questions, we can answer them because we did those great qualitative surveys of these participants. So as has been said over the last couple days, SEED was the first demonstration of child savings account in the United States, and this was before kindergarten and college, before Maine, before SEED OK, before we had our 10 policy points that you're supposed to do. I mean, all of these sites had to come up from scratch, a new CSA program. And so there were 12 community-based sites throughout the country, and then there was Michigan, which was Oakland Livingston Human Service Agency, and Don Jones is here, who was critical in getting the money and the quasi-experimental design here in Michigan. And again, it's a demonstration. So really, it was a 4-year demonstration, so pretty much 2004 to 2008, and then the program was over. But they were also allowed to open 500 accounts. Most of the other accounts are smaller, like 75, but also had the privilege and the honor to try to quickly enroll 500 in a program that no one had ever heard about it, and they were creating from scratch. To give you a little bit about the metro region in Detroit, so this is Detroit, which is, according to Kerwin Institute, the lowest opportunity area. And opportunity in this case is measured by education data, economy and employment data, and the neighborhood statistics. And so if you look, the lowest opportunity areas are around Detroit, and then this is Pontiac. Now, Oakland and Livingston counties are very wealthy counties, so they're very high opportunity, but right in the middle is Pontiac, which is a pretty low-income community. And just to kind of bring this home a little bit, when you look at spatial segregation, Detroit and Pontiac are where the most highest concentration of African Americans are in the state, at least in the region. So just to give you a sense of kind of where we're talking about. And so even though the counties are wealthy, the majority of participants came from the Pontiac area. So we have a very complex research design. So we had 14 Head Start centers, and they were matched. So 7 Head Start centers were considered treatment, 7 were considered control. There was a baseline interview that was done by RTI in 2004. There was a Wave 2 survey that was done in 2008. There was quarterly data collected from TIA-CREF throughout the intervention period. And then Ann and I and one other student helped with qualitative follow-up between 2013 and 2015. And then we also were able to get one more set of account data from TIA-CREF for December of 2015 to see what was happening with the accounts at the point of the qualitative interviews. So the control group just got usual Head Start services, whatever the Head Start families got. And of course, these are low-income families, and it's a pretty intensive intervention anyways with Head Start. But for the treatment group, they got the Michigan 529 savings plan with the $800 deposit. If they were below a certain income level, like $47,000 or something like that, they were eligible for a $200 state deposit match. And then they were matched for any family savings 1-to-1 up to $1,200. So if they'd saved the full $1,200, got matched, and were low income, they could have $3,400 at the end of this period with matches and incentives. There was a whole seed staff, so they did home visits, they sent reminders, they gave support, and linked them to other resources that were available at OSA and in the area. And so the treatment group kind of got all of these special services in addition to what was happening in Head Start. So 790 people took the baseline survey. That was 409 treatment, 381 controls. And then all of this was before they were actually able to sign up for accounts. So it turns out that of those 381 treatment, only 62% actually enrolled in accounts and 146 did not. And then amongst those that opened accounts, about 38% made additional deposits and the rest did not. Quite a few did the second wave survey, and then we had 50 families that participated in qualitative interviews. And just so you understand that these are pretty low-income families that had a lot of barriers, 60% fell below the federal poverty line, 85% below 150 of the federal poverty line. 2/3 had severe or moderate housing burdens. 22% reported food insufficiency, 35% reported economic pressure, and 8% had 2 or more moves just in the previous year. So a lot of instability and a lot of barriers amongst this household. Just to give you a sense of where the accounts were, as of the end of, at the end of the formal program in 2008, the large majority were here. Around the median. So that means they had the $1,000 and whatever growth had accrued, but a lot of that more. But there were a few that it saved additional, right? By the time you got to 2015, that, if you remember, this was like 85% before, so a few less were just in this amount that was just pretty much the $1,000 and whatever growth had occurred, but a few more now had started to save and have their own money account, and a few outliers had over $12,000 in their accounts. So this is where the accounts were, and remember, after 2008, the program had ended, the staff went on and did other things, but families did continue to engage in the account, and some continued to save. Okay, so administrative match. So about a year and a half ago, we applied to the state of Michigan to get access to state data. And then after we applied, about 6 months later, we were told we were approved. And then about 6 months after that, we started to get data. And so literally about a month ago, we got the first set of data. But that was just for the accounts that we knew had TIA seed accounts. We had no idea about the experimental design. And so we said, we really would like. So we asked again, and we can't match to our survey data yet, even though we will make the request in the future, but we at least have our survey design, so we know who was in treatment, who was in control, who had accounts, and who didn't have accounts. But as we saw before, half of the people who had accounts were in the treatment group, and half of the people who had accounts weren't. And so even though it's not intent to treat, and even though economists probably wouldn't like it, we are showing results for everybody who has accounts, as well as those who were in the control group, and you'll see that in just a second. What's nice, though, is that we sent this number for match, and about 90% of the people we sent with name and birth date and gender got matched. So we got pretty good match rates, right at 90%. Obviously, for each of these different indicators, the numbers go down a little bit, but I think eventually we'll have good graduation data for everybody. And just so you'll know, these young people are slated to graduate 2018, which is last year, 2019, which for most hasn't happened yet, and then 2020, which is the following year. So we only have graduation data now for 2018 graduates. But we also have 3rd grade and 6th grade standardized test scores, and SAT, and 11th grade. So this is for the 2018 cohort. So this is about a third of the students, so it's a pretty small portion of the overall group. And really, I guess to make a long story short, there's no statistical significance. And so account holders, it looks like, are slightly more likely to be on time for graduating, but it's not statistically significant. And when you get down to the treatment and control group, it may look that the control group is slightly more likely to graduate on time. So really, but none of it's statistically significant, but the numbers are pretty small at this point. So once we have all of 2018, all of 2019, all of 2020, we can hopefully say more about the likelihood of having account helping lead to higher graduation rates. But we also have test scores, and it's a little more interesting here. So this is 3rd grade English or reading proficiency scores. And so you'll find that account holders are more likely to score advanced or higher, and it's actually significant for account holders, for those who are in the treatment group with accounts, and then even intent to treat. So this seems to be a pretty robust effect. So the higher reading scores in 3rd grade. Again, not much going on in math scores, and if anything, if you look at intent to treat, the control group might be doing a little bit better on math scores. But 6th grade, you have account holders are more likely to be proficient or advanced, and it's significant across all account holders, but not if you look at the treatment group at this point in the reading. And then in math scores, again, for the account holders, they're more likely to score higher on math in 6th grade. And then we're getting to 11th grade SAT scores. And again, for reading, for all account holders, they're more likely, and looks, 42 versus 33% to meet the benchmark, and it's positive at 0.05% significance. And then for those who are in the treatment group who have accounts, overall it's not significant, but for the most disadvantaged. To those who are economically disadvantaged and who are in special education, there is a slight positive indication on reading. And what's interesting here is that this is the state economic disadvantage. This is free and reduced lunch. Once we get our survey data, we can actually see parental income, parental education, home ownership. We can do a lot more controls once we have the survey data. This is just state collected data on free reduced lunch and special education status. But at least for the treatment group, for the most disadvantaged, it looks like there's a slight positive effect on reading scores. And then, of course, with the math scores, no statistical significance. But again, here, there's only 2 cohorts who have taken the 11th SAT scores. There's still a cohort who was in 10th grade when this data is collected, so we still will have, hopefully, as we get bigger numbers, we can start seeing more effects. So I know, so that's where we are right now on this very preliminary data. But I guess in summary, Michigan seat accounts don't seem to make a huge difference in graduating from high school at this point for the class of 2018, but there does seem to be influence on standardized test scores, particularly reading and math in 6th grade, and possibly more so for the economic disadvantaged. But as I said, these are still very, very early results. We don't have graduation data from 2019 and 2020. We haven't yet linked our survey data. So when we have better background information for statistical controls, hopefully we can get more robust findings. And we don't have any data yet on college or post-secondary enrollment. But what's great about having that 90% match, any data that comes through in the future we can access. So as they start to enroll in college, as they start to graduate from college, as they, if they didn't take the test score that year, but they take the SAT at some other point, I mean, we can always, as the young people continue to go with that match, whatever data the state collects, we will have access to. So even though it's early and even though it's preliminary, I think over time we can say a lot more about this sample as we go forward. And so that is it.
Thanks, Trina. Questions for Trina?
I was just curious at the beginning when you started, you talked about the economics. People might not like some of the data that you were using or something to that. Do you guys work with the School of Economics to see if there's an opportunity to partner in getting data and improving the value of CSAs? Just curious.
Well, I mean, I know economists, and if we needed to, we could get. We are partnering with the School of Public Policy, and some of them are economists as well as sociologists. But I don't think it's a matter of partnering with economists. I think it's the fact that a difference between a randomized control, almost like Zabay was saying, the difference between a randomized control where you can say very certainly it is the program, and then you have intent to treat, as opposed to all account holders, because there could be selective effects for those who and decided to enroll in an account, because particularly with OSA, I'll give one small caveat. I probably shouldn't say this, but it's not a big deal. So the first year, they didn't get all of their 500 accounts, so they actually continued to enroll people the next year, and that's why we have 2018, 2019, and 2020 graduates. And it turns out that 2 people who were in the control group officially have accounts. And so I don't know if after that first year they moved to another Head Start center that was a treatment center, but it's just 2, so it's not a big deal. But so even with the experimental design, that was experimental design before baseline, before they even offered accounts. So and then 2 years later, people were still enrolling in accounts. So it could be that those who enrolled in account in the second year might be slightly different than those who are in the control and treatment groups. But I think these are all Head Start families. Most of them are for Pontiac. Most of them are economically disadvantaged. So I don't think it's as dangerous just to have a you know, nationally representative sample, because these are all Head Start families and all have some level of disadvantage. But economists would say you probably should only do intent to treat.
Robert, maybe?
Oh, okay.
Thank you, everyone, for today's panel. I really enjoyed it. So my question is about, and maybe I apologize if I missed it, what is sort of the baseline high school graduation rate for your population of interest? Because if it's already really high, then you might expect less to have an impact there. And in Philadelphia, we really, really care, the school district really cares about the test score data, so the reading and the math. And so once they exit high school, it's about having that improved academic preparation, so that you have positive impacts there. That to me is the most exciting. But
yeah.
I had that question about the graduation.
And particularly better reading and math scores for the most disadvantaged. I mean, I think that's a huge, huge statement. But if you're interested, statewide average education is 81 on-time graduation. But for Pontiac, it's 60%. And so our participants are a little higher than Pontiac, but a little less than the state.
Amanda?
Yeah, thanks, Trina. Can you talk a little bit about the experience the families had in the first couple years, the sign up, and the ways that there was communication with them first couple years, and then now they're 15 years old or whatever they are? What communications have happened?
Okay, so there's a lot of interesting things you could say about communication about the accounts. So because we did the baseline data first, and then we went to the Head Start centers and tried to get them enrolling accounts. And I guess people who work with 529 accounts, you had to have someone from TIAA when they did the official to come and kind of explain. And so just to give one anecdotal, at one point, one of the TIAA person who came to explain was a very formal and talked about all the risk and all the difficulties, and not a lot of people signed up right away. But then the second time, it was a guy from TIAA who was from the community, who was African American, who said, I have to tell you about all the risk, but you need to sign up for these accounts. They're giving you $1,000, take it. And a lot of people signed up. So just that kind of, who's presenting the risk and assessment data can make a big difference. But then after that first set of years when there weren't a lot of people signing up for accounts, the seat staff actually did one-on-one kind of house visits with people and had a whole information packet and gave them information, had the sign-up forms there. We actually changed from the very beginning where people had to make that initial $25 deposit, but we actually allowed the $800 deposit to actually open the accounts. And then again, so they could enroll in real time as they were told about the accounts, as opposed to, when can I get $200? Do I need to think about risk? And so, so I think that once those seed participants, seed staff actually started talking individually to parents and being able to talk about all the, how much money could be earned over time. This is really a win-win for you and your families. I think it was a lot easier to get that those enrollment numbers up. And then in terms, they wanted to do more at the Head Start sites, like financial education, and so I went to a couple of the family fun nights and kind of financial education things, and not very many people showed up. But I think it was more, you're talking Head Start families who, have a lot of things going on, and only 7 of the sites were seed sites, so you couldn't get the whole Head Start, community kind of behind it. But what was nice is each Head Start center had a dedicated seed staff person who actually worked with them and would answer questions for them and would meet with them and would take phone calls. So I think they got that kind of personalized attention, even if it wasn't in the Head Start centers per se. And Don, if you want to say anything more about any of that, but yeah, that's kind of, I would say, the first couple years. But remember, the kids were only in Head Start for 1 or 2 years, and even the program was still gone for 4 years. Then they went on to kindergarten and first grade, and then there were a whole bunch of different schools, and it wasn't just the Head Start centers anymore. Because really, it was when they were in preschool, and then at some point they graduated. Just a statement in the middle. And since Ann and I did the qualitative interviews, I can say that people moved around a lot, and so sometimes they didn't have the right addresses. So when we met with participants, particularly account holders, we actually helped them reconnect with TIA if they weren't getting the quarterly statements. But some of them still were. And for those who did update their addresses or didn't move, they would get those regular quarterly statements from TIA, but no more staff support after that point, and nothing in the schools at that point. So one thing I would say is it was high touch those first few years, but after that, it was a demonstration, it was over. So for those of you who have programs who are in schools or in communities, you don't just have the 4 years and it's up. You find ways that you continue to engage with parents, and that would make the impact probably of whatever child accounts you have much stronger.
So do we have 5 minutes left for the whole panel? Oh, okay. All right. So then I'm not going to ask my last question. We're just going to move into opening the whole panel up for discussion. 10 minutes? We got 10 minutes. All right. So let's start in the back there. Thank you, Trina.
Just give me a moment.
There you go.
All right, I'm Holly Marabella. I'm with the Cash Campaign of Maryland. I really appreciate all of your research. I also know that you had a pretty short period of time to talk about some very robust findings. But I'm curious if anyone has disaggregated data by race. I know that, we've talked over the past couple of days about racial equity being a component and a goal in CSA programming. And unfortunately, we can't sort of make that argument in the policy world or as we're designing our programs if we don't have that data. So I'm curious if anyone has disaggregated by race. If not, why not? And I'd love to see that as a sort of central component in research going forward.
Well, once we link up to our survey data, we can do disaggregation by race, but right now we just have kind of treatment and control. But from the wave 1 data baseline and wave 2 data, we have results by race. And so there are, I've done a whole paper about who signed up and who didn't about race, if you're interested in that. But these results right now, until I get it connected to the survey data, we can't say anything by race. But Michael, and C.O.K. can.
In general, the results are that in almost all outcomes, there's no difference by race, which we interpret to mean that if you introduce one of these policies, then the people of color and underrepresented minorities will do as well as everyone else, which is an improvement in the current asset structure. So that's the result. It's really quite. This is one of the times when no result or no significant difference result is really a very important result.
Anyone else on the panel want to speak to that?
For our study on Maine and Indiana, our sample is 97% are all white, so we couldn't do much with the race variable, really. So that's probably what we want to do more in the future, to collect data from a more diverse population. But just because the population in the sites that we're collecting data from is just very white.
Yeah. And did you want to?
Sorry, I think it doesn't apply to Italy. No, I mean, I could tell you a little bit more about migration background, if it interacts with the treatment, but it wasn't, so we didn't find any interaction effects according to migration background. But we don't have a race issue.
Yeah. And kind of similarly for the Indiana study, it's 97% white. For St. Louis, we don't, I don't believe that we have access to that data for this purposes. So one of the, it's a beautiful thing to do population level randomized trials. It does restrict sort of what data is available to you because you're trying to protect your subjects. So it's a little, but it's possible. We can look into it. Yeah.
Go ahead.
Trina and Don, correct me if I'm wrong, but I think the MySeed results are all the more impressive because of the fact that I think we underestimated the difficulty of creating the sample and recruitment, so that by the time the recruitment was done, the kids were out of the schools. I mean, and so it was very hard to actually apply any kind of education or interaction with the parents. So I just say that because I think it magnifies the fact that there were results at all, as well as underscores the effort Trina and the researchers had to go to follow. But it also, there is a tension between doing programming and setting up the research right at the same time.
We have a question over here. Over here, please.
Oh, sorry.
So also Ann Yeoman, sorry, also has at that time had staff that were already pretty well versed in asset building because they've been in that network in Michigan, IDA network and so forth. And so it makes me wonder if in your case, or if anyone else has studies or thoughts about this, where you have a situation in which the staff is also actively engaged and or is very knowledgeable about other kinds of asset building opportunities, like using EITC, like getting banked, like all these other various other saving mechanisms. How does that play into the results that one might get out of any given place? As we know, at least from a couple of demonstrations that happened in Pennsylvania, really the very first thing that happened was the staff needed to understand these things. The staff were one step removed themselves from being in serious financial difficulty. And it really made a big difference, the sorts of training and education and experience that the staff had in terms of what the effects on the participating families were.
I agree. Yes. The one thing I would say, though, because when we went to find the qualitative sample, the seed staff, even though they were no longer seed staff, some of them continued to maintain relationships with families, continued to connect them to resources, and because also still existed, even though seed no longer existed, I think that was a positive thing for some of these households.
So when you say seed staff, were these the Head Start staff that sort of had this assignment, that they were a whole other set of people?
Yeah. Yeah, I mean, there were Head Start teachers who some were very supportive and helpful, but they didn't get a lot of extra load to do this. So there was initially 4 and then 5 staff eventually, and each staff was assigned, so one staff was assigned to the big Pontiac site, and then all the other staff were assigned 1 or 2 Head Start sites, and they went to the schools, they provided information, they continued to communicate with families as best they could.
Carl Riss, Prosperity Now. Trina, again, thanks. This is so wonderful to see this data. My question is on the on-time graduation rates, account holders and non-account holders, much higher than Pontiac City? And is that like a Head Start effect, or is that just comparing Pontiac City to folks who are either city or also Oakland, Livingston County families?
Well, for example, the biggest seed treatment site was at the Ulsa site. What was that called, Don? Baldwin? Well, Cesar Chavez, but anyways, and so probably of the 500 account holders, like 300 were from that side, or a lot were from that side. And then around there, you had Walled Lake, Royal Oak, Farmington, some places that were a little more well off. And so I think on average, they probably should be doing better than Pontiac, but they probably aren't going to be doing as well as the state, just because you do have the majority of them are going to be from Pontiac and low income. So I don't think you could say that is a count effect. I think you could say that it could be that it was slightly more diverse than just the city of Pontiac.
Yeah. Frank.
Of when we started the enrollment and when the program ended? Because I wanted to make a contextual comment, and I want to make sure I'm right.
Okay. So the 2004-2005 Head Start year was the first year, but they continued to enroll in 2005-2006 to get the 500 accounts. But then the program ended December 2008 with some slight follow-up to 2009.
So I think one of the things that unfortunately for all of the seed work, it happened either just prior to the huge recession or during it. And I know that there have been other studies done in Detroit. I know Sheldon Danziger did a really large study of the impacts of the recession on low-income people in Detroit, and there were huge impacts in terms of disruption to families' lives, loss of access to human services. So I think, just that's a framework to interpret a lot of this, because unfortunately the timing was not great.
When we did qualitative follow-up interviews, I mean, some of those households had lost jobs, been unemployed for long periods of time, had moved, lost their home, foreclosed. I mean, just all sorts of economic devastation, because from 2008 to when we caught up with them in 2013, they'd gone through a huge upheaval. And even when I did the qualitative data just to see who signed up for accounts and who didn't, I mean, the stock market was crashing as they were deciding whether or not they're going to stay with these accounts. And people were like, well, I don't understand the stock market anyways, but I see the news, and I see that, my money's going to drop. And so even if they wanted to save, if they didn't understand that over time it might recover, but at that moment it wasn't doing very well. So that's an important point for sure.
Yeah. I think it was like 64% or something like that.
Don, did you want to say something?
Don Jones, the
then at the Oakland Livingston Human Services. So just one anecdote in terms of just thinking about the beginning, when, as Trina was saying, when we first went, we were so excited about this program. We were going to provide $1,000 essentially to these Head Start families, and so we invite them and we say, remembering this is very early on, children's savings account, what the heck is that? Even 529s were still, you know, written for these folks relatively new. We said we're going to give you, open this account at $1,000, and they didn't believe us. They just said, if something's too good to be true, it probably is not true. So that became part of that method of the education part.
Was there one more hand?
Can I ask a question?
Please, ask a question.
So I think, like, the research is really cool, and I think, Dr. Shanks, one of the things that you said was, like, the community champions, which kind of goes to your anecdote of, like, how do you get those people to, like, catch the vision of it? And so I'm guessing, like, I'm wondering what is the practical implications of how do you get people on the ground to, like, sign up for them or engage or get excited, because that seemed to be one of the things you talked about. So I don't know if anybody has.
Well, I'd like David to say a little bit about Italy. I mean, what do people think about these programs there? I mean, is it something that's catching ground, or is it still kind of just a pilot kind of thing? And I will respond, but.
Yeah, I think it's more the second, so it's a pilot kind of thing, as you say. So basically, we have had no impact on the policy debate so far, to be honest. So so we are still in that was the only CSA application that has ever been implemented in Italy, and fortunately it was evaluated, and fortunately it has good impact. Good impact estimates. We are, as I said, we are trying to do another policy demonstration on a younger population, and we hope that this is gonna help us reinforce the message and the results, and it's gonna help us streamline this mechanism into policy making in financial aid. Yeah.
And I would just say, just all the people who are here, who are engaged for 2.5 days, shows that there's interest. And I think as we get more and more accounts, and we get more and more stories, I think the interest will just continue to grow. But obviously, people in the audience here are the ones who are hopefully becoming champions if they aren't already. And so hopefully that will continue. Yeah.
I'm going to ask one last question, since I asked you guys to prepare for this, and maybe this will spark discussion in our break that I know we're about to go into. And the question, I'm going to do the higher order one, just is what, from each of your perspective, we'll just go down the row, what is the gaps, or what do you think is the biggest gap in the current knowledge base around the impact of CSAs that research needs to address?
Well, I'll speak about the rewards card component, just given that's sort of the research I presented. I mean, I think really, and I think in line with what I talked about, we need to understand a lot about sort of why people use these things or don't use them. What are sort of the barriers to using them? For example, we know in some cases that the grocery store that offers the rewards card is too far away from your house, right? And you're just not going to go use it. So we need to understand all those different pieces. And I think there's also a sort of there's a number of systemic things too that we'd want to understand related to sort of the full portfolio of vendors that would be involved in this kind of thing. So can you expand this so that you can use that rewards card not just at a grocery store but all over the place in your local community? And is there a tipping point where there's no incentive at some point to for the vendors to want to be a part of this and to provide the rewards, or does it just become expected because everybody's doing it? There's a lot of questions we need to answer about that to figure out how to maximize the benefit of these programs.
So from my perspective, and as I said, I have a more, let's say, financial education perspective. I think 3 things are missing. The first one is that we don't know if these programs work in terms of graduation rates. So far, we haven't no evidence as far as I know. Second thing, it will be really interesting to dig deeper into the mechanism. So why these programs are having the impacts that we have observed so far on college participation, on expectation, and so on and so forth. I think it's going to be helpful to make our argument strong that these programs have an advantage over other financial aid policies, such as scholarship. And the third one could be I have the impression that I'm new in this field in comparison to most of you, that there is need for improved comparability of results and comparability of programs across, not only across countries, but also, I guess, within the US. And I think that Prosperity Now fact sheet that was distributed yesterday goes into that direction. I think I have the feeling that many features of the program needs to be somehow standardized in order to gain an understanding, a comparative understanding of the programs.
My take on the gap in the field is mainly from the qualitative studies we have done, looking at how family talk about participating in the program, how really triggers their saving efforts and the financial socialization at home. They top up money and they getting very innovative, creative to getting extended family and friends to contribute to the account. I think a lot of time we're talking about the interim outcomes that the CSA produce. I think these are the outcomes like family engagement, community bonding. That's the things I didn't see a lot in this field. I think that's very, very important to measure, and I don't know how to best measure them yet. I think that's the, some of the outcomes I would like to see in the field. I think that could build to the CSA field, how this can pack the whole community together.
I mean, one thing I've always been concerned about is just how CSAs are going to affect the most disadvantaged. So for CSA and Seat Michigan, it seems a little bit that the most disadvantaged get more benefit, and maybe also from Italy. But rather than just kind of what happens absent anything else, how can you be more intentional with account plus programming to actually to try to change some of the disparities, particularly in the US context that exist. And the other thing I think would be important is how to link CSAs well to other systems. So CSAs in schools, CSAs in workforce development, CSAs in neighborhood-based programs. And then the one other point that came from the qualitative work that Ann and I have done in our in-depth interviews is when parents with accounts communicate with the kids about the accounts, the children don't just want to go to college, but they're very concrete. I'm going to go to a 2-year college first because I can use this money to pay for that. And so what ways can we help parents? So not just messaging about savings, but messaging about at key points in times what information, particularly for children who are first generation or who don't have family who've gone to college, how can you get messaging that will help them engage in school and actually be prepared for this opportunity? So whether that's advising, whether that's just realistic information about college cost, but getting that messaging right at each point in time, I think will make these programs even stronger and more impactful.
All right. Well, thank you very much, and I think it's break time, right? All right, thanks.
So good morning or good late morning to everyone. My name's Hannah Thomas and I'm with Apt Associates. And I am the understudy to Dave Szyminski today, who unfortunately was not able to be here to moderate the panel, so I'm stepping into his place. And I wanted to begin the panel by just framing this sort of question for the overall, I guess the overall field, and thinking about common metrics and research design, right? These are sort of pieces, a gnarly and deep thing for us to be thinking about as a field, but hopefully one that might begin to move us forward in terms of how we're all thinking about kind of the collective impact of the field as a whole. So the Child Savings Account Initiative is a program that we are doing work with the Consumer Financial Protection Bureau and with Prosperity Now. And Shira and Carl, who are here, are both involved with this project. It's sponsored out of the Office on Community Affairs, and Dave Szyminski is the project director, I guess, for this initiative out of that office. The goal of the initiative that Dave really came to us trying to, and Prosperity Now to try to move forward is to identify and document and advance promising and proven practices that can increase child savings opportunities for more families with low incomes and low wealth, and thinking about how to take that to scale. And so within this project, we've been doing several different pieces of work, some of which you've already seen as a field. We worked, Prosperity Now kind of took the lead around doing a more comprehensive field scan. We've done a conceptual framework, which we presented in 2018 to the field, and some case studies, which just came out yesterday. And there's a link up here to where you can find those new case studies that just have been released. And a core piece of this that right now that we're working on is thinking about this question of common metrics and research sharing infrastructure, so that as a field there's kind of a way to engage with one another across the field, and think about how to find sort of common places that programs can be compared across the field. And this was really a piece that came out of a convening we held last year at the CFPB, where it was really identified as a kind of a core need. And so we're taking this on with Prosperity Now and the CFPB. Just to give you a quick overview of the project team, the key person at CFPB, or the key people at CFPB, are Dave Sminsky and Colin O'Rourke. And then at Apt Associates, we have a team of about 5 of us working on this, including myself and Kimberly Burnett, who is really taking the lead on this key metrics piece. Again, she wasn't able to be here today, and sends her regrets, but she's really been leading this common metrics piece forward. And then at Prosperity Now, I mentioned Shira and Carl and Erin Thiemann. So with the Common Metrics and Research Sharing Project, we wanted to give you a chance to just, I think some of you have heard about this, and I wanted to give you a chance to hear, for those that haven't heard about it, hear what it is, and then give you an update kind of on where we are. And also then think about this panel kind of as a way to dive into deeper conversation around this topic. So our goal is to try to support efforts to develop research infrastructure across the CSA field, with the goal of sharing knowledge and resources, identifying best practices, improving program evaluations, helping programs facilitate comparisons across programs, right? Right now we've had a lot of looking at programs in depth and evaluations of the program, but how do we kind of compare across those programs so that we can be comparing apples to apples? And then giving us some overall data about the field. So we have a set of deliverables that we're trying to produce for this, some recommendations for common metrics. We're trying to also create a manual for local program evaluators, right? There's a lot of program evaluation happening that's really great and of really high standard. And we want to help sort of move that forward with offering best practices that the field has learned about in terms of how to do that sort of local program evaluation. And then provide a web-based clearinghouse where CSA researchers and program administrators can come together and share resources and tools and research studies. Guiding us in this effort, we have a steering committee, many of whom are in this room right now. I'm not going to read through the list, but we're very grateful for their involvement. But this is not the sum total, right? If there are input and suggestions that others who are not involved in the steering committee would like to give, we're very open to it and welcome all thoughts and input. We have a timeline. There are different phases of this project. We've completed so far the first 2 phases of discovery, as we're calling them, where we're doing kind of a desk review of existing published resources and interviewing researchers and industry observers. And then in the phase 2, which we've already also completed, we've been interviewing CSA program staff and getting samples of data that CSA programs are collecting. Right now, we're in the production phase, as we're calling it, where we are synthesizing all of that information and trying to make sense of it so that we can produce something to give back to you as a field to get your response to. And then we would incorporate feedback and make revisions in a somewhat iterative process because we realize that our first go at this will be very drafty. So if you have input, we welcome feedback. Here's some contact information. Please take down these contact details, and I can share this with folks who are at the conference as well through other means, maybe on the website. And be in touch with us. We're very interested in hearing feedback and thoughts on the project and insights that you've gained about measurement and research design in your CSA programs to date. So with that, we have a team or panel here of great researchers and people who have been wrestling with some of the gnarly questions around research design and measurement in the field of CSA programs. I'm going to do introductions to the panelists each as they come up. So we're going to start with Robert Nathanson here. He is at the University of Pennsylvania and doing really interesting work there, evaluating Pennsylvania's CSA program. So with that, Robert.
Morning, everyone. It's a real pleasure to be here. Thank you very much to Willie and to the University of Michigan. I really enjoyed being here the last couple days and meeting so many people. So my name is Robert Nathanson. I am at the Consortium for Policy Research in Education, or CPRE, which is a research institute in the School of Education at the University of Pennsylvania. And today I'm going to be talking about a partnership with the Pennsylvania Treasury around 529 accounts and college savings accounts. And I'll be talking today about college savings behavior of Pennsylvania households in 529 plans, which is an overview of some of the work that we're doing. So I want to talk briefly about the partnership and the research focus, and then I'm going to talk about, I think, three main themes which I think are of interest. One, which is looking at account behavior over time. There's been a lot of focus over the last couple of days about how do we get people to open accounts? How do we get them to start savings? Well, what do those savings look like, not just in CSAs, but in 529s in general? We want people to be able to accumulate assets over time. So looking at those long-term trends. I want to look a little bit about geographic variation. Thank you. Please let me know if you can't hear me. Geographic variation, so what it looks like across the state in those saving patterns, and then a little bit very preliminary about the impacts of the 2017 tax law. Okay. And so this partnership with the Pennsylvania Treasury got started because they launched Keystone Scholars, which is a statewide CSA initiative. It went statewide on January 1st, which means anybody who's a Pennsylvania resident that has a new baby or adopts a child in 2019 is eligible for the seed funding of $100. And it was piloted in 2018. The main research questions that the Treasury wants to answer initially is the impact of the program on parental expectations for the children's future, as well as does it then incentivize families to open their own 529 account and start contributing. So that work is about to get started. We sent the treasurer, Joe Torsella, the final survey questions on Wednesday, and so we're going to be launching a survey, and then that data is going to start trickling in throughout the year. As part of this partnership, I have access to account data on 529 holders for the whole state of Pennsylvania. So anyone who has a Pennsylvania 529, most of these are Pennsylvania residents, but not all, and the data comes through our partners at a census. So we're very grateful to them. And so there are about 300,000 accounts in Pennsylvania, and the data includes if the accounts are open, if they're closed, the age of the beneficiary, the age of the owner, the zip code in which they reside. And what's key is that I know quarterly contribution and withdrawals by account starting in the Q1 2006. So I can follow longitudinal patterns at the account level over time. And so there are two main plan types in Pennsylvania. There's the prepaid plan, which they call the guaranteed savings plan, where you buy a credit now, it's worth a credit tomorrow, it's worth a credit when you use it for qualified higher education expenses. And then the stock market plan, which they call the investment plan, which is run through Vanguard. And so the goal of this work is to really, I think that there's a lot of key insights that can be learned from looking at this large secondary data set, which can help inform the Treasury and other states throughout the country that are running 529s. What do the patterns look like for these households? The Treasury in Pennsylvania is specifically interested in expanding 529 use across the whole income distribution. They know that a lot of higher income households are using this. The CSA is a way to make this universal, but they want the families to use them and to continue to save. And so the idea really is around mining the data that already exists to understand who's saving, who's not saving, and how can we help improve that. Okay. So I want to just preview just a number of different findings. So the first is, if we look at savings over time, I split accounts into 4 types. There's the savings plan, the guaranteed savings plan, which is the prepaid plan, and the investment plan, IP, which is the stock market approach. And I split them into whether the accounts are automated or not automated. So if the account is automated, whether it's the stock market or if it's the pre-save plan, basically households contribute on an annual basis. It's very high, it's close to 100%. But if households don't automate the accounts, pretty quickly the likelihood that they contribute on an annual basis decreases. So the households in that bottom line is the investment plan, the stock market approach. And so 40% of households after the 4th year have stopped contributing. And the average age when these accounts are opened is about age 6 or 7. And so there's a lot of years that the families have to take advantage of these savings, but 40% aren't after year 4. In the prepaid plan, about 25% are not after the 4th year. And so this is really important to think about when the accounts are set up. Do we want the accounts to be automated, set it, forget about it? That seems to be helpful for if accounts are going to be continuing to contribute. Okay. When we look at the magnitude of the contribution, so conditional on having an account and contributing to the account, what are the size of the contributions? And this is across all 529s, not just individuals on CSAs. And so there's evidence that families are front-loading the accounts. They put an initial amount, a higher amount, and then they quickly kind of decrease to a steady state on an annual basis of what those contributions might be. But what's really interesting is you can see the 2 lines are crossing. So those top 2 lines that cross represent the investment plan. And so the automated accounts that are the investment plan, the stock market plan, over time, when the accounts are 4 or 5 years old, the annual contribution is actually higher in the automated accounts as compared to the non-automated accounts. And that's also the same in the prepaid plan, where the lines cross at about year 5 and a 5.5. And so as the accounts age, some people think there may be a selection issue on families that are choosing to automate or not automate, but over time, it might be that the best and most effective strategy from a magnitude of the account is to have them be automated. Okay. And I have this information quarterly too in the appendix. Okay. So then we wanted to look at geographic variation. So how does it vary across the state? And so Pennsylvania every year creates a number of maps that they put in their annual reports. And there's a lot of information here. They have the number of accounts that are open, the number of the penetration rate, which is the percent of households that have an account divided by the total number of households with children in the county, the total size of the value of the accounts in those counties. So what I did something very similar, but instead of splitting it this way, I ranked them by quintiles. And so what I've done is each of these colors represents a different quintile, or a different 20th percent of the income distribution, where the bottom 20th percent are those dark oranges, and the highest are the light blue, are the middle blues, and the dark blue are the top 5%, the top 5%, the 95th percentile. And so the question here is, where are families saving? Where are they electing to open? Oh, thank you. 529s across the state. And In the Philadelphia suburbs, in the suburban areas, the penetration rate is highest. So the likelihood that a family has an account is really clustered in the suburban areas. And this is true at the county level. And I should say that in the middle of the state, that's where State College is, and that other dark blue one, those are the western suburbs of Harrisburg. But mostly it's around Pittsburgh and Philadelphia, and it's true at the county level, and it's also true at the zip code level. And so we have very granular data on knowing which communities are saving, which are under saving compared to expectation on the median income in that county or in that household. So we can predict which communities are saving more than you would expect, which are saving less than you would expect based off of neighborhood characteristics. Okay. And then we can look at Philadelphia specifically. In Philadelphia, the proportion of households that are contributing the most are those in the middle of the city, in Center City and Rittenhouse, which is the wealthiest area, in Old City and Graduate Hospital, and less so in the other parts of the city. And so I think it's really powerful to think about when we're thinking about how do we implement these programs, how are we trying to grow assets for communities, what are the communities that we should be targeting, where are they located, if we're going to test programs, if we're going to introduce reward cards, where are the communities that we want to do that, where do we want to pilot, where do we think that there's the most need, and where can it be most effective. Okay. And then I just have a couple more slides, and one other measure which I think is really interesting is because in Pennsylvania you can choose between the investment plan and the guaranteed savings plan. That choice is not randomly distributed across geographies. So the likelihood that a family is choosing the stock market approach versus the prepaid approach, there's community level variation such that in the population areas, in the suburbs, they're more likely to choose the investment plan. In the more rural areas, they're more likely to choose the prepaid plan. And so I don't know what the mechanisms are for that, and I'm not making a value judgment. But if the accounts are open when the children are 4 or 5 or 6, and you want to take advantage of the time value of money, it's probably the best strategy to put the money in the investment plan so that it can grow the largest amount to grow assets. And certainly the case that there are decisions that is not necessarily being made depending on the area of the state. And so I think that's really important to understand. Okay. And so then when I talked about 2 days ago, I just wanted to have some very preliminary results in the 2017 tax law. And so the 2017 tax law said that you can use up to $10,000 a year for public or private school tuition, essentially private school tuition, and you can use it from a 529. Pennsylvania made the decision that that would be tax deductible at the state level. So our Pennsylvania's tax is about 3%, just over, and so if a family's household income is $50,000 and they spend $5,000 in tuition for a Catholic school, thank you, that $5,000 would reduce their state-adjusted gross income from $50,000 to $45,000, and it would be $153 in tax savings. If it's $10,000, they save $300 in tax savings. And so the real question is, what are the implications of this for college savings? Is there any cannibalization given that it was expanded to K to 12? And in Pennsylvania, people advertised to use 529s in this way. Ted Cruz tweeted about it last year on May 29th. He's probably going to tweet about it again this year. Okay. So what I've done is I've tried to plot the number of withdrawals that were at least $100 by year starting in 2013. And there's some noise. People will withdraw a little bit about money and they pay some penalty, but there's an increase after the law change. And so the dots represent whether they're kind of the lighter gray diamonds or the darker gray circles, the investment plan and the guaranteed savings plan. And most of these are pre-existing accounts. The red dots are new accounts that were taking withdrawals, but most of the accounts are pre-existing accounts. And so there's a spike. There were about 3,800 in 2018 individual accounts with withdrawals over more than $100 where the children were under the age of 18. Now I have to say I haven't separated if they're qualified withdrawals or if they're non-qualified withdrawals, if they're rollovers, if they're high school students taking college courses. I haven't separated those out yet. But there's certainly a spike after the implementation of the law, and about 11% of those were $10,000 specifically. So there's bunching at the $10,000 maximum of families taking those withdrawals. So the question is then for these families, and this is my last slide. What are the implications? Are they cannibalizing their college savings? So if they're taking out money for K to 12, are the savings less for college? And so for conditional on families withdrawing at least $100, and these are accounts which have been open for a long time, the children are under the age of 18, they've been open for at least 5 years, there may be a slight spike in the contributions, but there's a huge increase in the withdrawals, such that the net contribution in the quarter in 2018 is negative. And so the families then have less money available for higher education expenses. And the extent to which that's of use to the family, I don't make a value judgment on it, but to the extent that we value 529s as a tool for college savings, there's evidence that some families are using this to pay their private school tuition. Okay, and so that's essentially what I wanted to talk about. All of this is preliminary, and I think they're really interesting and important questions that can be developed through the 529 data. We will be able to match some of these 529 accounts to race ethnicity, and we can see openings by geography and by race ethnicity, by merging different government data sets. And so this is really all to help the Pennsylvania Treasury inform strategies to help people save. Okay. Thank you very much.
Okay, so oh, good, the microphone's working. So I'm hoping that what we can do after each of the speakers is ask questions. So are there any clarifying questions or thoughts that this is raising, that Robert's presentation raised for folks?
Robert, thank you very much. Justin King. That's fascinating information, and that's access to 529 data that not everybody gets all the time. We've talked a long time in the field about needing and wanting to make that data more publicly available more frequently. So thank you for sharing it. It's really remarkable. Two questions I have. One is, what level of penetration did you need to reach to be in the top quintile for 520? Can you give us some context for what the Philly suburbs percentage participation looks like to put them in the high bracket there, and how that compares to other communities? And then the other question I had is the data about K to 12 or under 18 withdrawals spiking is pretty, I'm going to use a word I shouldn't here because I'm not a statistician or an academic, significant. And so much so that I wonder if you or others in the room who have expertise in the market side of 529s, does that raise concerns about systemic impacts on 529 operations? Does this create potentially a market challenge for CSA operators? And again, thank you so much for sharing that. It's really, really interesting.
Can everyone hear me? Okay. And I'm happy to share these, but the top 5%, the cutoff for penetration is about 26%. So it's still relatively low. For the top 20%, it's about 19% of the penetration rate. So 529s are relatively, the penetration rate is relatively low. There is a data issue in Pennsylvania such that Pennsylvania allows you to claim the state tax deduction even if you invest in another state's 529. So we do know that from contributions, there are about 20% of contributions are being flowed out of state. And so the penetration rate, and particularly the suburban areas, is probably higher, but it's impossible to observe without merging Treasury data with revenue data. Yeah. When it comes to the K-12 withdrawals, I want to be very careful. This is all very, very preliminary. I haven't netted qualified and unqualified. I set it for children under the age of 18. I think I should set it for maybe under 16 to separate some noise or some families that are taking college credit while they're in high school. Whether it's a concern to I don't think it's a concern to 529s in general. I think that's probably what happening is very savvy higher income households, and I can do this by zip code and I haven't, are taking advantage. I mean, you can deposit the tuition you want to spend in the 529, and when the money clears, you can take it out a few days later and claim the deduction. So from that regard, with the state benefit, I think it's a tax transfer. And different states have decided to allow this or not to allow this. New York said no, Pennsylvania said yes. But this is early, and so it's the case that Pennsylvania could change their minds. I don't think it changes the long-term viability, but it is early, and there are about 230,000 children that go to private school in Pennsylvania, and this was about 3,800. So if it starts to diffuse, then that might have implications for tax revenue. So I've done some of the basis point calculations on the potential revenue, but I would want to wait for a few more years to see what that looks like. Yeah.
One last question. Oh, one last question.
It's really terrific, Robert.
Thank you.
And because you have all these data, you're going to be in a position to talk about as the Pennsylvania Kids Account program moves forward. You're going to be in a position to talk about, because you have these data, like to what extent is the 529 platform being transformed for the city? And this is already on your mind. I know that this would be a terrific contribution to the field to even step by step the 529 in Pennsylvania is now doing. You know, it looks a little different, and over time, I think this would be just a terrific contribution. Thank you very much.
Thank you.
I think they can hear in the back. If you can hold the mic a little closer, everybody.
Okay, great. So we're going to move to any more questions you have, hold them for the discussion after we've finished all the presentations. We're going to move to our next panelist, who is Terry Sable. She's an assistant professor at Northwestern University and has developed a really interesting measure that she's going to be sharing with us. So this is getting down into the weeds of measurement now. And we started at the bigger picture with Robert's presentation, and this will bring us down into some of the really sort of dense and, well, not dense, hopefully not dense data questions, but really getting into fine-grained detail here.
Great, thank you. Hi, everyone. I'm Terry Sable. We're going to pivot pretty remarkably from large-scale data to the assessment of young children. And so I'm delighted to be here today to talk to you about a tool that we've developed to assess how young children make meaning of school and college, and particularly its use in a study of CSAs. I want to acknowledge all of our collaborators, in particular the Oakland Promise team, who are collaborating with us to help us pilot and develop this tool. So I'm going to try to, so I'm a developmental psychologist by training, and so I'm going to talk a little bit about sort of the theory of change, because that was sort of the basis for thinking about how to create an aligned measurement tool, and give you a little bit, but not too much, sort of on what the development of this tool looked like and our pilot work in Oakland Promise, and then kind of a summary of conclusions and next steps. I am a researcher, and it feels a little weird to be presenting about without sort of real numbers, so I have to do the clause of this is very early and sort of to show you what this looks like, but there are about 100 million questions left, and so you know, this is a little bit out of my comfort zone to talk about sort of tool development rather than outcomes. So I think we can all sort of agree that we know that one of the biggest predictors of the likelihood that you enroll or graduate from college is your family's own income, assets, and savings. but that the ways in which we think this affects children, and particularly their likelihood of attending college, are through sort of a set of family level processes. So things like if you have, we know from family investment theory that families who have more money are likely to provide more opportunities to their children, and in turn that might lead to increased college enrollment and graduation. In the same way about sort of expectations for going to college, which a number of you have presented about this morning. At the individual level, we also think that there's sort of a set of characteristics within individual children, and in this case, I'm not really thinking about parents, but more kids, that are sort of tied both to their aptitude and motivation to go to college, but also sort of their identity and how they sort of make meaning of all the external influences on them and the likelihood that they would attend. And so we all are sort of recognizing that, or not recognizing the fact that family income is not destiny, right? And that there's a possibility to sort of disrupt this narrative and think about ways in which we can promote children's likelihood of enrolling in college and attendance. And for purposes of this talk, I could talk about each individual of these pieces, and I'm sure a number of you have studies that are looking at all these different components, but for purposes of this talk, I'm just gonna focus on the identity component. And this work is largely based on Willie's work and others that really thinks about how do you assess how children, are children more likely to attend college when they believe that's sort of part of their future self? And Willie sort of identifies three main components, the first being the identity salience. This is the idea that your sort of idea of going to college is tied to who you are. I will go to college in the future. Congruence with group, which thinks about, kids like me go to college, so you identify with relevant social groups that eventually will go to college. And then interpretation of difficulty, which is, look, I know going to college is going to be hard, but I have a plan of how to get there. So I have a savings account, or my family is saving for college. And most of this work is really based on school-age children, and rightly so. We think that that's sort of where identity development is sort of peaking. But the open question is sort of how do we think about this with young children, right? Like I can't sit down with a 4-year-old and say, tell me about your identity as it relates to college, right? That won't really work if you've ever been around a 4-year-old. So, what can we think about this in terms of sort of both a downward extension of the ideas that have been tested with school-age children, but also what are the new constructs? And so we set out to develop a tool called, that it really assesses children's internal representations of college and school. And in some sense, this is sort of on this identity spectrum, right? We know what happens in early childhood matters. We have decades of research to suggest this. So how do we pick up on how kids are making meaning of their external influences, both explicitly and implicitly? So that's sort of where it fits within our theory of change. This was an open question, and one in which we were sort of open to the possibility that we would fail miserably. And this is because the state of research in this field is actually pretty sparse. So most of the research in the past across all topic areas, not just in terms of college going, but in terms of income, understanding of inequities, things like this, are typically based on older children and very little on young children. And so our goal was to develop a developmentally informed, low-cost tool that could assess how young children are beginning to make meaning of going to college and school, or what, in sort of a jargony way, internal representations. You can imagine the challenges of doing this kind of work. Again, if you've ever been around a 5-year-old or 4-year-old, they're having emerging language abilities, short attention spans. They oftentimes have sort of this social desirability of trying to get the answer right, quote unquote. And also, if I'm going to go and try to assess a young child and I don't know them, what's the probability that they're going to be sort of honest with me? And so what we did is draw upon sort of an age-old tool that's based on decades of research that came out of the University of Berkeley by the Cowens, who are also psychologists, who used puppets, live puppets, to assess young children's understanding. Actually, in this case, was about domestic violence and marital discord. And the idea behind puppet techniques comes out of therapy, which is really that kids love puppets, and they relate to kids on their own terms, and the idea is to create sort of a peer-like exchange, right? So rather than me, this assessor coming in and asking them questions, that you're really creating sort of a peer-like exchange. And we've used this tool in some of our own work in a study of workforce development training for parents while kids are enrolled in Head Start in Tulsa, Oklahoma. And as one who's used this tool before, the challenge with it is it's incredibly time intensive. The training takes a lot of time to get assessors to be able to do it right. And there's huge sort of variation in coding. And so it was hours of reviewing videos, and in some sense it just felt a little bit antiquated. So we developed a tool called the Child Assessment Tool Electronic, aka the Chatty, that basically tries to maintain the core elements of this puppet-like exchange, but create sort of a quicker, more reliable version that could be sort of implemented at scale. And so on the left is the original puppet, and we've now modified it for a tablet-based version with these little puppets named Fuzzy and Fluffy. So the idea here is that two identical animated figures speak to the child and present different statements, like school is fun, school is not fun, and then the child is prompted to select the one that's most like them. So what this looks like, if I can get any of these videos.
I go to school. I do not go to school. Which one of us is more like you? Me too.
And this is a practice question because we know all the kids go to school, and so this is to see if they're actually getting this tool. So what happens is an assessor, either one-on-one or one-on-two, implements this with a tablet-based tool. For fear I would show you this, but we don't have a ton of time. But basically, sort of sets it up that this is these are your friends. Do you want to talk to them today? They're just interested to hear more about what you think and are think about college and school. So to develop the scale, we basically started with these core elements from the school age work and tried to think about what would downward extension of those elements look like. And then added on two other domains, which were about school dynamics, which is really related about self-efficacy and whether you like going to school, as well as money and savings. Like, do you even know that that your parents or your family are saving for college? So we took these constructs and basically tried to map on items with that. So, simple things like I will go to college, I will not go to college, my friends are smart, my friends are not smart, and just sort of mapped on and created items across each of those subscales. So I'll just show you what this looks like in action with a live child.
That's like me. I save money for college. I do not save money for college. Which one of us is more like you? Me too. My parent does not think I will go to college. My parent thinks I will go to college. That's like me.
So full disclosure, this is a very famous child. It's Mark Hernandez's son, and he rightly selected that his parent thinks he will go to college. So job well done, Mark. We have piloted this in 8 sites, many of them in Oakland, but also in Chicago, through the Oakland Promise study. And the tool was really designed for kindergartners, so this was part of their kindergarten to college intervention, where they're offering both CSAs as well as a kindergarten curriculum, as well as support for parents. And so trying to think about how this might work within the evaluation of that, which I believe others have spoken about. And our main goals were first feasibility. What would this look like to implement in schools? But more importantly, like if we're using words like college and savings, do 5-year-olds even know what those mean? And then lastly, like what questions are working and what questions aren't working? And so to save time, so there's sort of a range of responses. So this child says college is when you're a teenager, you go to college. And the other child says college is a place where you learn. And the responses basically fall around, college is school, college is a place where you work and learn, a place where you go where you're older, a place where you go to have fun, or other responses. And And I'll sort of skip through these, but what we were encouraged by is about 75% of the kids were sort of getting what college was, which was actually unexpected. I wasn't expecting the rate to be that high. Some of these kids were actually enrolled in the intervention at the time, so potentially, this is picking up treatment effects, but in some sense, I'm encouraged at least that kids were sort of picking up on that. In terms of the what are you saving money for, responses ranged from very tangible things like to buy a tablet, like maybe she wanted that tablet, to going to college. And that was pretty mapped onto sort of what we found from our responses, where about a third of the kids were saying, I'm actually saving money for college. And maybe they were primed from some of the questions, but it still was interesting to us, and then others were, sort of specific. But all of which is, I'm encouraged by the fact that only 10% of the kids had responses that basically made no sense, suggesting that they're sort of understanding what this tool is doing. And then lastly, in terms of thinking about what questions work and don't work, we basically did item reduction in terms of variability. So one of our questions was college is soon versus college is a long time from now. Well, for young kids, college is actually a long time from now, right? So what's the right answer? So things like that just didn't actually work. So we ended up doing a confirmatory factor analysis and ended up with about 36 items that sort of had good psychometric properties. And to remind you, this was sort of our original model of what we were expecting, or the constructs we were expecting to measure, and basically end up with 2 of the subscales we hypothesized, which was this identity salience and group congruence, but then ended up sort of lumping interpretation of difficulty in school dynamics, which actually kind of makes sense. As well, and the money and savings items actually did not hang together. We're going to keep them in there, but it's kind of interesting that those weren't sort of hanging together. And then we added on a construct of socioeconomic status. This isn't what I would consider an outcome, but more potentially a moderator. So, right, so do kids' perceptions of their income moderate the extent to which they sort of understand CSAs? So here are the items as they sort of fall around. I'll sort of, I'm happy to share these. And so in sum, children can generally understand words like college and savings, or at least 5-year-olds can, and that many of the identities constructs, I think in some ways surprising to us, can be modified for use with young children. And this isn't to say you should take items that you use with 10-year-olds and just plug them in with 5-year-olds, but to think about those sort of core constructs and think about sort of the downward extension of those core constructs. But also that suggests new constructs like school dynamics, which I do hypothesize that kids might just feel more connected to school as a function of having sort of this long-term goal of going to college, and we might be seeing that for young children. But of course, this is super early stages, and we need to understand, what this is related to, both in the short term and the long term. So, as I've been working on this, I think there's sort of this question of what is the role of a tool like this? So in some sense, it could be considered sort of an early outcome. And so, does a CSA or some sort of asset development intervention have an effect on young children's internal representations? But in some sense, I think we're all interested in this not as an outcome, but as either sort of a step along the way and a later predictor of outcomes we care about, right? So does this relate to later self-efficacy, academic achievement, right? What is how might we make sense of effects on academic achievement? And so for the first one, the study is underway, but for the second one, that's going to take a long time, right? If you start assessing 5-year-olds, like we're going to have to be at this for a long time to look at those effects. And so, that's sort of an open question for the field, is like, how much time are we willing to wait, and can we sort of buy that this is an important outcome in and of itself? So I'll just conclude with that. It's really important to align your measurement to a theory of change and to have this developmental lens, and not just, to think about what is it we really think is happening with young children, as they're experiencing this, and that, how young children make sense of their own lives, like all of us, is an important piece of the study and the story. It's not easy to measure, but it's one that I think is worth doing. So thank you.
Can I make one quick clarification? So that the group college bound identity and stuff is built on Daphne Oserman's work, and so the actual different components, salience and stuff, were all developed by Daphne Oserman. We just used them within the field of social work to explain how this is working, not social, but CSAs. Sorry, I have to go, so I wanted to say that real quick. Thank you.
So Colleen Quint from Maine, I have a quick question. So this is fascinating. The question I have for right now is whether you're doing any kind of like pre and post administration of that tool for kids, like at the beginning of the kindergarten year and at the end of the kindergarten year, or at different stages in their interactions with the program, like Oakland Promise. And then related to that, are you anticipating doing future iterations of it so that there's one experience like this that kids have in kindergarten, and then the next iteration of that with a slightly older dog with slightly different questions with the same subtext to them than that they do in the 3rd grade or the 6th grade or whatever. So. We won't have pre-tests, is my understanding, but we will be following children over time. I'm confirming this with, and so, and you know, I think it's an interesting question, and we've also talked about, you know, what would be the adaptation for older kids. So, you know, some folks have used surveys, and that actually might work with older kids. Like, they might not need all the fanfare of these little puppets. And so, you know, I think the constructs might hold, but sort of the modality might differ too developmentally. And yeah, good idea to have fuzzy and fluffy age.
I'm loud. So you can okay, there we go. Okay. So I'm Ashley Edgerson from Fund My Future Milwaukee, but we work with predominantly K-5-year-olds. They're all K-5-year-olds. And so a lot of the things that you've observed, I have observed as well. So for the kids to say, if you ask them, do you know what college is? I was the same as you, was kind of shocked that they knew already sort of what it was. And so they knew that it was another institution where they can learn. Obviously, they didn't use the word institution, but it's another place where they can learn, they can grow, they can develop. So we went from that space then to creating a sort of a career identity. And so now we're focusing more on what you want to be when you grow up. And then as they get older, to sort of collect as they grow, get more detailed in the tools that they'll need to become what it is that they want to be when they grow up. So I am very interested to learn more from your side of things on your engagement with the 5-year-olds, because I really want to see how we can tie the two and making sure that we're keeping that college-bound identity in that conversation. But I think it's working well for them to know, like, if I want to be a police officer, these are the things that I will need to get there. So I guess my question was if you if you added in sort of that concept of like college is also for you to be able to, you know, work towards your dream goal, which means X, Y, Z.
Yeah, it's, so we did actually ask kids what they wanted to be when they grew up. I didn't present those data, but I'm in the same idea, which is, you know, we know from the parenting literature, or sorry, the adult literature, that having a career identity is really important in terms of sort of persistence in education and training. And so, you know, we would think that what does that look like with young children? And I'm actually with you that it's like, who do I want to be when I grow up, right? And so, yeah, we have those same questions. And so I think we're thinking similarly. You know, it's a different construct, but an important one. And I think the more we can add on these constructs of what they look like in young children, I think the better.
Okay, one last question here.
Yeah, this is more of a comment. Tom Egan with the Community Link Foundation. I too, you know, we're talking savings, college. I really appreciate asking children, you know, what does this mean to you? Although I'm still stuck on what Clint said on Wednesday when he heard the comment that college is like recess all day long. I think you should add that one in there too.
It is, I will say, a lot of kids, when they say, what are you going to do to college, they say play, right? So it's, you know, have fun. But maybe that's not such a bad thing, right?
Okay, great. So our next person on the panel is Eric Hedberg, who is at NORC. Eric is involved with the Oakland Promises Brilliant Baby Program. He's doing involved in that evaluation. And he's going to be talking a little bit here about how to think about some specific aspects of research design around particularly sample size.
Hello? Okay, great.
I would have said college is for fun. But I also saw Animal House at a very young age. That's how I got to be a sociologist. Okay, thank you all. Good. Are we at the afternoon yet? Well, yes, good afternoon. Okay, so I'm going to do something that a lot of methodologists don't do, and I'm going to sort of talk to you first before I show you the Greek. What we generally want to know with a lot of our studies, right, are more or less two things. We want to know, does this study work as implemented, right? What are the policy effects? That's sort of what we call our intent to treat. But we also want to know, how well does it work for those who pick up the program, those who comply, those who, blessedly do what we tell them to do in our randomized trials. And those two give us a sense, give us sort of a range at the effectiveness of the program. What we need to do to sort of reach that end result in a conclusive way is we need to have a good sample size. And a lot of the quasi-experimental studies, especially those we've seen here today, involve rather large sample sizes. But to get a quasi-experimental effect, you have to match, you have to do propensity weights. All of those things hurt your statistical chances of picking up an effect. On the converse side, you could do a randomized trial, but randomized trials are hard. I know because we're doing one in Oakland right now. And they're well worth it, and they're hard, and they're very worthwhile, but they're kind of like the Oregon Trail, if anyone remembers playing the Oregon Trail as a kid. At some point you could die of dysentery. And it's sort of this long process. So when you do a power analysis, when you ask the question, how much sample do I need? It's really sort of, how do I provision my cases? How many supplies do I need as I go on this trail of a randomized trial? So what I'm going to present to you today is sort of a couple of tools to help you for a very particular type of design, but a design that I think is very salient for this room, and one that we're implementing in Oakland, which is you have a main intervention, in this case the CSA, but you also have these other components that you think are very important and very effective. And unfortunately, there's going to be some non-compliance with those additional components, so I'll talk about that. So anyways, that's sort of what we're talking about today. I'd like to acknowledge both the team in Oakland, Dr. Elliott, and my colleagues at NORC. And I think we've already heard about the Brilliant Baby program, but just to give a quick overview, it's part of this Oakland Promise, and it provides college savings accounts, and it also provides financial coaching. And so we want to see what's the effectiveness of the college savings accounts and what's the effectiveness of the financial coaching. So those are the two components, and we sort of have various research questions on how each of these components influence child health and development, family financial health, and parental stress. But we have a problem. We can't force people to do coaching, right? It's, by the very nature of how coaching works, you have to they have to buy into it, they have to want to participate, and they have to do it. So we have what we call, somewhat coldly in the experimental world, non-compliance. And what happens is we sort of, we randomize into 3 groups. This is sort of our plan. We have a control group, we randomize into those who only get a CSA, and then we randomize into a group that gets the CSA plus the coaching component, or are encouraged to do the coaching component. But due to people who may not want to pick up coaching, you sort of wind up with these fuzzy groups over here that come out of the 3rd group. The people who actually do the coaching, which represent the CSA plus coaching, and then the people who were encouraged to do coaching but only do the CSAs. So I'm going to skip past a lot of this stuff because, and I can just, I'll just tell you what it is. We want to randomize. Randomization is really important because it's really the only technology, design technology that we are aware of that lets us definitively, or as close to definitively as possible, say that this is the thing that caused these differences. This is the program that caused these differences. Without that, it's quasi-experimental, and it can be strong quasi-experimental effects, but you don't get that gold star that you get with randomization. And there's all sorts of math on why that works and everything. So when we deal with coaching, and we want to look at a coaching effect, we have a couple of options. One is we can do the intent to treat, which is where we look at the differences between those who only receive, I'm making noise, am I radioactive here? Okay. We look at the differences between those who get CSA and who are also encouraged to pick up coaching compared to just the CSA only. And if we look at those differences, that gives us the sort of, as it's implemented, as the policy would have an effect on the population. But because some people choose not to pick up coaching, that doesn't necessarily tell us what the coaching effect is if everybody picked it up. So we could also do a naive as treated analysis, where we sort of say, okay, we put everyone who picked up coaching into sort of the coaching group, and we take the people who were encouraged to do coaching, but put them in the control group. That's the sort of as treated or what happened analysis. And there's some math to show that that's actually a really bad idea. And the third option, which we're going to talk about here, is the treatment on the treated, which involves a little extra analysis, but it gives us that sort of second research question, which is, how would this work if everybody did it? Again, I'm not going to go through this slide, but this is just backup in case you don't believe me. Yeah. You always, like, people usually believe me when I show the Greek, but they really believe me when I wear a tie, and I forgot a tie, so. But more or less what happens is people, because they choose to pick up the coaching if they're encouraged to do so, that introduces all this non-random stuff, right? You know, whether they had their coffee that morning, their background, their socioeconomic situation, you know, whether they liked the person offering it to them, all those sort of non-random junk gets brought into their decision. And once it's non-random, well, we lose that gold star. And so that's why this as-treated analysis is a bad idea. But what we can do is, with some decomposition, we can do what's called an instrumental variable analysis, which essentially says, okay, let's use a really good predictor of choosing to pick up coaching and bring that in as part of our analysis. And the best, thank you, and the best predictor of choosing to pick up coaching is being assigned to that random third group of being encouraged it. Because those who weren't encouraged can't choose to do it. So it's a really good predictor. And so I'm going to get to the important stuff, the sample size. I'm not going to show you how I got to these formulas, because that would be tiring and you haven't had lunch yet, and I'm not going to do that to you. But what's important is we can come up with formulas that say, okay, if we expect a certain effect, and we can do during the Q&A, I can offer some advice on how to come to that expectation. But if we expect a certain effect, and we expect a certain proportion of those who were offered coaching or the optional program to pick it up, we can then back out how big of a sample we need to have a reasonable chance of picking up this effect. And more or less, that formula is down here. And I'll show it to you again when it's a little bit higher and heads aren't in front of it. So it's right here. And basically, the formula for how many cases you need in each group is basically this guy, which involves this delta, which is the effect size, sort of how much bigger is the treatment group going to be in standard deviation units. It involves this compliance rate, and 2 times this M factor, which is just 2.8. Just remember 2.8 as the M factor. And this tells you how big of a sample you need in each group. We have 3 groups, so you need 3 of those. And here's a curve that shows you, as the effect size grows, you need fewer and fewer cases, right? I often tell people that power analysis is sort of an analogy to microphones and sounds, right? This microphone is my sample. If I'm very quiet, you can't hear anything. But if I'm really loud, you can. And the bigger the microphone, the quieter the sound you can hear. That's sort of my analogy for sample sizes as I try to explain to people why that's important. And this is basically what this graph is showing you. If you have a really small effect size, 0.2 standard deviations, you need a really big mic to pick it up. But as your sample, as your effect size, your noise the program causes gets bigger, you need less and less cases. And so this is an important analysis to do before you start your study, before you go on the Oregon Trail, because it tells you what you need in order to have a reasonable chance of walking away saying it's significant. This is also something you want to do after your study if you don't find significance, because if you don't find significance, but you're way underpowered, thank you, if you're way underpowered, then it's really an inconclusive finding, because the sound could be out there, you were just using your cell phone to pick it up. Or if you were powered and you didn't find anything, you can generally be confident that maybe this effect, or at least an effect of this size, isn't out there. However, when you have non-compliance, or when people choose not to pick up the optional program, things get even worse. This blue line is if 75% or 3/4 of those encouraged to pick up coaching actually pick it up. But as that drops to, say, only 1/4 of the people pick up, you need 7,000 cases to pick up a really small effect size, right? And who's going to get, so this is, again, you want high compliance. Doesn't have to be perfect, but you want a lot of compliance. And then this is a little bit more Greek that sort of shows you how the compliance rate relates to the overall effect. It's this sort of factor here, which again tells you that less compliance, you need way bigger samples. So I'll end with some conclusions. I hope that was relatively painless. But I could give you all sorts of books and nerdy stuff to read. This sort of 3-arm randomized trial design is really good if you have an optional component that you don't think everybody's going to pick up. The sample size is bigger because you have 3 groups. Now you need 3 per group instead of 2 per group. But the necessary sample size is quite sensitive to the compliance rate. So if you want to test whether this optional component works, be prepared to collect a lot of data. And then the formulas provided, I'm happy to share with them, happy to give you some programs that calculate them, some Excel files and stuff. The formulas provided here provide a test for the main effect, the optional effect relative to main, and the total effect. So again, I'm not here to sort of say, now that you know this, go forth. This is more of an advertisement that this is some technology we developed to plan our studies in Oakland, and I hope it's useful for the larger group. So thank you very much.
So any questions here from the group? Yeah, go for it.
I'm curious, if the theory of change is sort of long-term effects with CSAs. So I'm thinking about the effect sizes for Michigan on academic achievement were pretty, 0.1, 0.2 around. And then long-term effect sizes we might expect might even be smaller. So how do you think about long-term, powering for studies kind of over the long term, given the range of effect sizes we might expect in short term versus long term?
Can you hear me?
I think you just turned it off.
Oh, no. There we go. Okay. In with a bang. Large effect size. So there's 2 things working against you in long-term outcomes. One is the fact that your control group tends to catch up, right? There's sort of this regression to the mean aspect. Now, if you work with populations that tend to have sort of lower scores and there's more room to grow, you can sometimes maintain those large effect sizes. But that's one thing working against you in long-term studies. The other thing is just losing people and attrition. And as you lose people, it gets harder to detect the smaller effect sizes that typically happen over time. So when you are powering your study, you sort of want to say, okay, what's the effect going to be when I reach Oregon? I'm sorry, that's a dumb analogy. I just thought of it. So what's the effect size that you're going to get when you actually end the study? And what's your sample that you're going to have left? And then there's other sort of gnarly details because people don't drop out of studies randomly. So then you got to wait or you got to find out some other way to sort of compensate. But yeah, you know, when you power studies, you want to think of the end game.
With a demonstration which a number of, same model tested in different places where the first end line was 2 years out, then it was 3, but then now people are going back 8 and 10 years later, and there's a hypothesis that some of those changes will decay, but that others may actually be may be increasing geometrically. So for example, you know, this program was giving people assets.
Right.
And then coaching and a bunch of things. And you see change, let's say 3 years out, but you hypothesize that as these are, take livestock, as their assets grow, they sort of multiply both actually, and empirically. But then, so do you then, you don't want to do your power based on the notion that this is a geometric change because you might miss it at 3 years out. So how do you balance change when your change is not linear, let's say, or not expected to be linear?
So my comment to that is all evaluations are in the context, in a social context, right? I'm a sociologist first. And what's most important is you power this study to give the answers to your stakeholders when they need them. So that's how I sort of sidestep that question a little bit, is to sort of say, you want to power the study, so if your stakeholders really need to have data 3 years out, power the study for that. If your stakeholders are willing to wait around till the kids are 18, then you can power the study for that. But, you know, and because this is all in balance with the resources it takes to do evaluations, when the stakeholders need their information, and those things. I mean, statistics are only, it's the hammer, but you got to worry about your wood, you got to worry about the weather, you got to worry about all this other stuff, and it's not this sort of sole consideration. Hopefully that helps out.
Eric, I'm going to just ask a question here as well.
Sure.
I mean, something that comes a lot up for us at APT when we're doing evaluations is when do you think about a program having enough treatment effect, right, to really be able to do an RCT?
So yeah, so I think of that in terms of what a lot of health people call a therapeutic effect. And in terms of, say, test scores, you know, you sort of want to look at the observational data and sort of say, you know, how many standard deviations of test scores is going to make a difference, right? And power to at least detect that. Because then if you don't detect that, one could say, well, we didn't have the sample to detect that effect size, but that must mean the effect size is actually smaller, and so, well, we know it's at least not that. Or it doesn't actually exist, or, you know, so on and so forth. So there's the therapeutic effect, which, you know, you can only really get by using, let's say, observational data. And that's where these sort of national data sets that follow students for quite a long time are very helpful, because you can sort of figure out through statistical stuff, you know, at what point do you have diminishing returns? So hopefully that helps. I mean, you know, my answer is usually going to be do more analysis.
All right, great. All right, so our final panelist here today is Michael Sheridan. I don't think he needs too much introduction. I think most people in the room know him, so I'm going to let him take the stage.
Okay, thanks, Hannah. I'm going to make a few kind of big picture comments, but really all of them spurred by our work on Seed OK and then listening. And let me say it's just wonderful this research is happening. Oh, sorry. Okay, thank you, Justin. Can you hear me? I'll look for you. Yeah, just shake your head that way when not working. Thank you. Yeah, so I'm going to make comments about Seed OK, and then the larger picture of doing research and some comments about what look like interesting constructs for us for measurement, both in the way that measurement or evaluations usually talked about effects on individuals and families, but I'm going to make some other comments about kinds of measurement that we don't often do, which have to do more with more with the structural components of what we're delivering, because all these projects are actually delivering different things. And I recognize in the room that most of you are with a particular program, so that might not be quite so relevant to you, but I think it's important that we keep these things in mind, because a lot of the variance is in the program that's being delivered and not necessarily in people's responses to it or their characteristics. So the first comment, there's a little brief about Seed for Oklahoma Kids Wave 3 at the back of the room, and you can pick it up if you're interested in it's a little summary of what it is. And we talked about Seed OK earlier, so I don't want to repeat that. I would like to thank Frank DiGiovanni, who made this possible at the Ford Foundation. Really huge investments to do a study like this. I prefer not to call it a randomized controlled trial, because it really is a long-term social experiment in a full population with no selection. It's really quite different from a short-term trial with a subpopulation or a selected sample. So I think it has been up till now an important piece of research for this field, and we're about to launch Wave 3, and that could be an additional have additional impact on the field, positive or negative. And I think Frank asked me how I'm feeling about Wave 3, and I told him I'm terrified, because we had a number of significant and meaningfully effect sizes meaningful at Wave 2 that have really informed the field and helped us move forward and inform policy progress. But that was based almost entirely on the Wave 2. So we did a baseline in 2007, and we did a Wave 2 at 2011. So kids were age 4. So we're now planning to go back and pick up kids at age 13 in 2020. And we have the funding in place to do that now, and put together a team, and Mark and others are on the advisory board. What I'm terrified about is that we stopped feeding our oxen on the Oregon Trail quite some time ago. And I think kind of useful analogy. The ideal policy for kids accounts is that you continue to deliver the treatment over time, but we were able to deliver treatment with initial deposit and some matching for 3 or 4 years, and we sent the kids a little T-shirt, the treatment kids a little T-shirt that said future college graduate, and a couple of books to read, and we did that for a few years. But basically, since they were age 4, we have done nothing except they get their quarterly statements from the treatment kids. Control kids also get statements if they happen to have a college savings plan. So our oxen are, have been they're kind of skinny now, and we still want them to get over the Rocky Mountains, So that's the kind of decay issue of the treatment. So to counteract that a little bit, we were fortunate to have a treatment sample that was big enough we could divide into 2. And we can then analyze as together or separately. So we're doing an additional treatment with half of the treatment group and making a deposit, another deposit into their account. And that's a progressive deposit, so the poorest families are getting as much as $500, and the wealthiest families getting very little. So we're offering this additional progressive deposit to see if this makes a difference. It's not really the same as feeding your oxen all the way along, but maybe it's like giving them a little bale of hay, just before they go up the mountain or something like that. All right, we'll stop that analogy.
Sorry.
Okay, so that's a Seed for Oklahoma Kids. I'll just make a few comments, and I don't want to talk too long. I'd rather have time for questions. I think I want to comment about what looked like useful constructs to us, and really I listened to social psychologists and listened to wow, this is such interesting things to measure. My brain just never has worked this way, but it's great to see this happening, and it's really important. But the constructs that make sense to us, or that people are responding to, are people really do want to know about people really want to know about savings more than asset accumulation. Our data or our analyses seem to show that asset accumulation probably explains much of the variance. In most cases, you know, it explains all of the variance, and savings doesn't explain an additional component. So it doesn't really, where these resources come from, I don't think is so important as the amount of resources. Related to this, we did qualitative work, Trina's study in Michigan, and I remember the qualitative work way back when, you know, when the study was young, is that people, even though this $800 that was posited into the accounts, mothers talked about this money as my savings. They used that language, even though it was given to them. So I think we shouldn't, and I would guess that all of us, which is most of us in this room that have some kind of retirement account, 401k or 403b or something like that, we look at this balance and we think that that's my retirement savings, right? And in fact, it's you know, it's been matched by your employer and it's getting a tax benefit from the government and so forth. So it's not totally an individual enterprise, but we're very happy to claim it and feel virtuous about it. So I think people will do that with asset accumulation. I think that's really important to understand that. The other variable that has made a lot of difference in discussions is there are a couple of them, educational expectations, and I think there's good reason that because there's evidence that educational expectations are really very much correlated with later educational achievement of children. So educational expectations really matter, and I'm sure we should try to pick it up in our studies. And the other one that's important is social emotional development. We do find a small effect size that's positive at wave 2. And for lack of better language, social emotional development is kind of like soft skills. It's like, you know, can you play well together? Can you get along, and can you like handle yourself with others? And this turns out to be, from Heckman's work, we know a really key component of future human capital development and future earnings. So I think we should pay a lot of attention to that if it exists, and make sure that we try to measure it. So my time is already almost up, but let me turn to the future. I think we do need a course, and this will be the most important work, and it takes a while to get there, but future educational attainment of children along the way, and actual education achievement, and do they eventually have a post-secondary credential. These are going to be critical, and if we're fortunate enough to keep following them, are they earning more money? Do they have earlier family formation? Do they have higher net worth compared to the control group, or whatever? I mean, I'm really happy to be doing experiment and feel lucky to do it. But all of this research, including a lot of times just talking to people, all of this is really valuable. So. I don't want to make you think that I think that I don't even use the term gold standard for experimental work. I think it's valuable, but I think all of this research is valuable. So don't be intimidated by what you're doing and think it's not so useful. So I want to I'll use my last couple of minutes to turn a little bit to what I think of as a sort of policy model research. And the variables that I think are important here, and this only makes sense really in comparison, but it can make sense. These variables can make sense looking at one program compared to some standard. So whatever that standard might be. So it's not completely useless to think about them within one program and report them. So I think the variables that we need to study include for this project inclusion. Or universality, or degree of universality, and I think this has to be more than an assertion, which it seems to be in the field today. I think this has to be a % of kids who are in the program compared to the population of kids, whatever that population is. And then if kids are not in the program, then it's really important to describe who those kids are. So both the kids in the program and out of the program. Asset building, and this I would, I don't know, we don't have measures for these things, so I'm just tossing them out. Asset building, maybe there should be a measure of how much of your program is based on what strategies for asset building. Actually, Prosperity Now does a good job of that in different categories of how resources are coming into the program. I think stability is really important, and that has a lot to do with the holder of the accounts, whether that's a stable funder, whether that funder's committed to this for the long term or not. I don't have a good suggestion for measure of that, but I don't think it's something that we can just dismiss. And that's related also to sustainability. And sustainability, I think, has a lot more to do with the efficiency of these programs. So some measure of efficiency of delivering the program, cost per unit, in some measure, and whether or not the funding structure can support that or is willing to support that. And I don't know. That also is not going to be an easy construct to measure, but I think it's important. And finally, I think there should be some measure of generativity. That is this policy model expanding? Are other people copying it? Is it happening in another location? Is it growing? So this is because we're a field that's growing. This measure, obviously, quite important. And it's something that we haven't usually measured, but maybe we could think about doing that. So this is like testing altogether, like program characteristics, testing structures are important. Like what kind of structure is this program? I said earlier that in a talk that it's not. They're very different. It's delivering children's accounts with a it's more than a financial product. It's a financial product sometimes with all kinds of conditions around it, and whether the conditions matter or not is part of the structure. It's a social structure. Can you use this money now? Can you use it later? And what conditions reflect that? So I think these are, because we know in the financial world structures cover a lot of the variance. And I'll give you just a simple example. There's great research in 401k plans that if you make an opt-out plan, you bump up enrollment from as much as 40%. So basically, this is not human behavior. This is like the structure's behavior. This is the policy behavior. So this idea is terrifically important. And I think human behavior also terrifically important. We should measure that, and we should measure strategies for improving it. But it's because so much of the variance can be in structures, we need to also try to capture like where that variance is and what good policy designs are. So I probably said more than enough, so thank you.
Great. Well, thank you very much, all our panelists. I want to open this up for the last 5 minutes here to the floor for questions and observations or comments. And I know we're sitting here between you and lunch, but yeah, let's just take a moment. Frank.
I've been struggling to think about, because as we think about these children's savings account programs, let's say you start in kindergarten and let's say we want to go out to 18, you would hypothesize that the identity you're measuring when you're kindergarten is going to change, right? It's going to adapt to your own internal growth, but to all the contexts in which you operate. So how do you capture that? I mean, and what would you recommend if we wanted to say we really ought to be measuring this? Because a lot of what we're trying to do is to influence college-going identity. So what would you recommend in terms of frequency of measurement? Holding constant resources, let's say. But just, given that this is malleable and kids are going to change, how would we account for this in not just in the measurement, but just in thinking about this conceptually?
So I created that little developmental perspective spectrum, and it was really challenging to fill it in because we don't actually have really clear targets for each age. It feels like the first step, and one that I did very crudely, but that one that I am still thinking about is, what is this developmental spectrum, and what are the discrete things that we might expect, from a developmental perspective, that would happen at different age groups. And I think unlimited measurement, get in there and start assessing kids, but I'd also assess their parents. So one thing that I haven't heard a lot about is kind of thinking about the home environment and parents, and beyond sort of like survey methods of, you know, what are your expectations for kids? Like what are the dynamics that are happening between parents and children? What's the cognitive stimulation in the home? The processes that we know matter for kids' development, like how does that sort of overlay with this intervention?
I just wanted to mention that Dr. James Comer at Yale has 50 years experience on dealing with children in poverty and their developmental needs. And he believes all children can learn if you get the developmental piece right, and he's proven it. And I think we need to take a look at the developmental needs, the experience that's already there, and think of how do we best integrate what we're trying to do with that experience.
I concur.
I wanted to first thank this panel and the panel before, because just the quality of research and the breadth of research in our field is exciting. It's very stimulating. And it's, you know, as Amanda Feinstein from Oakland Promise, I have the pleasure of working with Mark and Eric at NORC, and Terry. But I just wanted to also say, sort of from a practitioner's perspective, that evaluation is a really heavy lift, and it's expensive, and it's really worthwhile, and we don't only get our data from our formal evaluations. And so it's a little bit of a plug for the administrative data that we all collect in our programs that is also incredibly rich, and tells us a whole story about our impacts, and what families are experiencing and what they are achieving, as well as the qualitative information that we gather from our families. So as a program that invests heavily in formal research and believes strongly in formal research, I applaud that, and also want to really acknowledge the importance of just the data that we have from the people we serve, and how that part of what we've really discovered is, like, we've got all this data, we just need to kind of set aside some time to cull it and tell the story and really mine what we have in addition to what our evaluators have, because it's really rich as well.
Thanks, Amanda. And I have a follow-up question for you on that. In terms of, are there any sort of highlight lessons that you've learned as you've been implementing these evaluations and thinking about kind of on the program side, you're looking at your own administrative data?
Well, we're implementing the randomized control trial of Brilliant Baby with UCSF Benioff Children's Hospital, which is a federally qualified health clinic in Oakland. They enroll babies into the Brilliant Baby program and into the study. We're learning a lot about the complexity of explaining the study to families and the context of a pediatric visit. The importance of really having an ongoing and deep relationship with the staff at the clinic, who are explaining both Brilliant Baby and a study to families. Perhaps just the nature, the need for collaborative relationships and the incredible amount of time. And we meet every Monday morning for an hour for the last year and a half, all of 6 of us on the phone or in person, that it's intense and it's relationship-based to get these things off the ground. Because we're just at, I believe, 140 people in our 400-plus study pool with the families. We're not yet analyzing what we're learning about the families, but more learning about what it takes to get them into the program and to deliver the services effectively.
Willie wants me to make sure we eat lunch, but if you have a quick question, Bob, I'll let you ask.
It may be a question I shouldn't ask. So, but I am struck by, we do all of this incredible evaluation work on low-income populations and asset building. And the other side or or at least the mainstream kind of gets away with doing stuff with nothing, but also, you know, we know about how money accumulates in 401k programs. I mean, Michael, you've always pointed to this. I'm wondering whether there's a way we can use data from how institutions work for upper income people and white men to inform what we should be doing for everybody.
Yeah. I suppose my response to that, as a sociologist and less as a quantitative researcher, is when I was younger, and you know, a lot of people would tell me how great education was in California in the 60s, right? Or, you know, how great education was and how the education was of high quality for this, that, and the other thing, but it was for a certain strata of society. And I worry that wanting to understand the experiences of a higher strata of society, which is the product of centuries of social processes, how well that applies to another strata of society, which also is the product of centuries of social processes and, you know, not great things. So I always feel very cautious when, you know, I would say, you know, or when people would say something like, well, you know, education is working really great in, say, Scottsdale, Arizona. Why don't we just take those teachers and put them into inner city Detroit? I just don't know if that translates. So, but I don't know if that's popular opinion or not, but that's how I feel about it.
I took your question as kind of rhetorical, actually. So.
Oh, sorry.
No, I didn't. I appreciate your response, but I think a lot. It was a good response, but I think a lot depends on what our theoretical statement is, and if our theoretical statement is that assets matter in people's lives, then I recognize all the historical conditions and what everybody's brought to the table, but if we think, and maybe it's hubris for us to think that adding some assets on top of a bunch of historical injustice will make any difference. But that's our statement. So if that's our statement, then I think you're justified in saying, well, assets can accumulate this way. We know that, so why don't we do it over here?
All right, so great. Well, thank you, everyone, and mindful of lunch is over there on the side, and hopefully we can continue this discussion over lunch.
So